Thank you very much. Chair Frierson, you are now unmuted to the broadcast and may call the meeting to order whenever you're ready.
Thank you, and good morning, everyone. I will call the second meeting of the subcommittee to review and advise on Corona federal aid to order. Ms. Jones, could you please call the roll?
Thank you, Chairman Frierson. Senator Brooks?
Here.
Senator Cannizzaro?
Here.
Senator Goycochea?
Here.
Senator Keycapper?
Here.
Senator Parks for Senator Cancela?
Here.
Senator Woodhouse?
Here.
Assemblywoman Benitez Thompson?
Here.
Assemblywoman Howdigy?
Here.
Assemblywoman Monroe Moreno?
Here.
Assemblyman Roberts?
Here.
Assemblywoman Tolles?
Here.
Chair Frierson.
Here. Good morning, everyone, and thank you for being here. As we always do, we're going to start off with public comment in this meeting so that the public is aware. We will also have another area for public comment at the end of the meeting. As it's published on the agenda, you can make public comment via email, mail, or fax, or by calling in. The number is area code 669-900-6833. And there'll be sign-in instructions when you call in. Due to time constraints, public comment will be limited to 2 minutes per speaker. And I will take up to about 45 minutes for public comment at the beginning. And again, as I said, there'll be an additional opportunity at the end of the meeting to make public comment. LCB's broadcast and production staff are going to be interacting with those making public comment in order to facilitate their participation. So please add, we're ready with that. If BPS could add the first caller with any public comment to the meeting, and we'll kick off public comment.
Hello, Chair. The public comment line is up and working. However, nobody has called in this morning.
Chair, this is broadcast standby. Just one moment, please.
Hello, Chair. Can you hear me?
Chair, there are no callers in the public comment queue at this time.
All right, thank you. We will move on the agenda and go on to item 3, approval of the minutes from the September 11th, 2020 meeting. I will take a motion to approve the minutes from that meeting.
Move approval.
Motion to approve by Assemblywoman Benitez Thompson. Second.
Second.
Senator Woodhouse, I hear you.
That's correct. Thank you.
Thank you. Any discussion on the motion? All those in favor? I guess we have to do a roll call vote. So Ms. Jones, if you could please call the roll to record the vote.
Thank you, Chair Frierson. Senator Brooks?
Yes.
Senator Cannizzaro?
Yes.
Senator Goycochea?
Yes.
Senator Keycapper?
Yes.
Senator Parks?
Yes.
Senator Woodhouse?
Yes.
Assemblywoman Benitez Thompson,
Oh, yes.
Assemblywoman Howdigy,
Yes.
Assemblywoman Monroe Moreno,
Yes.
Assemblyman Roberts,
Yes.
Assemblywoman Tolles,
Yes.
Chair Frierson.
Yes.
Motion passes, Mr. Chair.
Thank you. Thank you, Ms. Jones. We will move forward with the rest of the agenda. Item 4, of course, today's meeting is going to focus on federal aid received by local government entities, and the subcommittee will be provided with updates on some select state programs. Of course, last meeting was with the executive branch, and now we're looking at local government. But I would like to take one item out of order. I believe that I'd like to move to item 5 first for Justice Hardesty and a review of the programs for alternative dispute resolution concerning evictions, which was Senate Bill 1 from the 32nd special session. I recognize that we can't have our Supreme Court Justice here hanging out all day long. So Justice Hardesty, if you are there, I would like to move on to allow you to make your presentation.
Mr. Chair, Broadcast and Production Services is in the process of adding Justice Hardesty to the meeting. One moment, please.
Thank you. If we could all be on standby.
Mr. Chair, this is broadcast. Mr. Hardesty is here and ready.
Great. Welcome, Justice Hardesty. Happy Friday.
Good morning.
Thank you for being here. We'll go ahead and allow you to make your presentation on item 5 on the ADR, evictions.
Thank you, Mr. Speaker and members of the subcommittee. As you know, on October 2nd, our staff provided to the fiscal analyst division staff a letter and attachments relating to the status of eviction mediation programs, and we attached some information to that letter to provide you an update. Since the legislature's second special session and the governor's approval of Senate Bill 1, the Access to Justice Commission expanded the work program and the work group to include representatives from landlord and realtors. The work group spent an extensive amount of time producing draft rules, which were later submitted to the Supreme Court. The Supreme Court then held public hearings on those draft rules, entered a tentative set for further comment, and on Tuesday of this week entered an order approving the final rules for what is captioned temporary residential summary eviction mediation rules. Those will go into effect on October 15th, and they address mediation for landlord-tenant summary eviction disputes and potential disputes under NRS 40.254 beginning on October 15th. There are 2 voluntary mediation programs already in place, both of which relate to mediation between the parties prior to the time that any court involvement would take place. The first of those is a mediation program stood up by the Las Vegas Justice Court in collaboration with the Neighborhood Justice Center, and the city of Sparks has also adopted an eviction prevention program. Both of those programs address mediation prior to the filing of an eviction case with the courts. I believe we supplied to you on Tuesday a copy of the rules that have been approved by the Supreme Court. There are a couple of remaining actions to complete prior to October 15th to stand up the program. The first is the appointment of Home Means Nevada as the administrator for the program. They have accepted that responsibility. They are currently working with a vendor to complete the portal that will allow access by the courts and mediators for appointment purposes and the communication of settlements and other information between tenants and landlords. The AOC is planning to initiate the work program, which would utilize $2 million of coronavirus relief funds to compensate mediators who are appointed under the program. And we've established a compensation range for those mediators. The court has been advised of 114 mediators who have qualified to be appointed as mediators. That will occur on Monday or Tuesday of next week. And they'll be available for these mediations to take place. The AOC is planning to use its current staff and its existing procedures to process invoices for payment without any increase in cost to the program or to the state beyond the Supreme Court and AOC's current budget resources. A couple of cautionary items I'd like to mention. As you all know, the coronavirus relief funds must be spent by the end of the year. To the extent that we don't spend those dollars and there are no other resources available after January 1st, the rules specifically provide that they sunset and the program terminates. By our investigation, we've been told, the court has been told, there may be other resources available to perpetuate the mediation program after the 1st of January, but we have no definitive source that's been identified. And if the coronavirus funds expire on December 31st, as currently provided, we'll have no funds to operate the program, and the rules call for the termination of the program. The other comment I wish to make is, as some of you on the subcommittee may be aware, the Center for Disease Control entered a moratoria on evictions soon after the governor extended the current moratoria under his Administrative Order 31 to October 15th. The CDC moratoria extends through the end of this calendar year. That raises the question about how many eviction matters will actually proceed in light of the CDC moratoria. One further point I want to bring to your attention is we have worked very hard coordinating with the Treasurer's Office, with Clark County, with Reno State Housing to allow mediators to connect with representatives of those dispersing rent relief funds. We believe that it is critical to the success of this program that mediators, while sitting with landlords and tenants in these mediation programs, be able to communicate and contact rent relief fund disbursement groups to be able to assure that that tenant is qualified for the funds, can access the funds, and that they can be dispersed promptly. We've also worked closely with DETR to be able to establish phone lines that will allow mediators to call while sitting with tenants real time to determine the status of that tenant's access to undispersed unemployment compensation checks. Those, I think, are critical pragmatic pieces to a successful mediation program in this context. I'm happy to answer any questions, Mr. Speaker, if there are any. And I thank you very much for allowing me to start early. I have a competing engagement or responsibility at 11.
Thank you, Justice Hardesty. Before I open it up, I had a couple of questions at the outset. At one point, I think you mentioned a figure of 10 million. And I thought I'm trying to scroll back and forth. I thought it was 2 million. Did I mishear you there?
I don't know. I couldn't quite hear what you said, Speaker, because of the video. The amount of $2 million has been available from the coronavirus relief funds to compensate mediators as part of this program. $2 million.
That was my question. I thought you said 10 million.
No, sir.
Okay.
If I did, I didn't mean to.
Okay. My other question is around the notion that by the end of the year, if no additional aid is provided, that the program will end by rule. And so I just kind of wanted to delve into that and whether or not that is going to leave people hanging that need the assistance, or if you're saying that the program will organically come to an end. While this subcommittee is going over monies that are expended and allocated, we can certainly also hear folks who want to make recommendations and pass those on. So I was just wanting to delve into about what really that means about the program ending by the end of the year.
Well, practically speaking, the coronavirus funds must be spent by December 30th or 31st. The only source of funds available to the mediation program to compensate mediators is that money. So to the extent that we can no longer actually spend it after the first of the year, we'll have no funds available to be able to compensate mediators. Likewise, there would be that would prevent the court from being able to operate an effective mediation program after January 1st. That's why the rule sunsets the program on that date. And I appreciate the fact that the subcommittee is looking into these matters, because I worry that there is going to be a confluence of events. First, the funds that are available, whether spent or not, are going to be gone or not available to the program after January 1st, at least the way they're currently allocated and appropriated by Congress. And second, with the CDC moratoria expiring on January 1st or December 31st, there'll be no further limitation on landlords' ability to pursue evictions. I'm not speaking about the propriety or impropriety of that. I'm just stating the facts. And so that suggests to me that when we reach, there won't be as much use this fall for the eviction program because of the presence of the CDC moratorium as one might otherwise have expected. And come January, there'll be no moratorium, but there'll be no money to be able to handle eviction mediations. That seems to me to be a problem.
Thank you. I mean, would you agree then? And when we say rule, you're talking about Supreme Court rule, but of course, if you don't have money to pay mediators, then you're kind of frozen. Would you agree then? I mean, I guess we're largely dependent on additional federal aid.
Yes, sir.
Okay. Other members, questions?
Mr. Chairman.
Go ahead, Tia.
Yes, thank you. Justice Hardesty, then in your opinion, the CDC moratorium does in fact stop any evictions until December 31st, even though the governor's isn't in place?
Well, if you don't mind, Senator, I'm going to equivocate on expressing an opinion because I frankly think that this is a legal question that could come before the court. I'll simply state that the CDC moratorium provides by its terms that it precludes this type of eviction until December 31st. Whether the CDC regulation or guidelines are legal or not are issues that are being litigated around the country and may be litigated in Nevada.
Thank you, but you were the guy to ask.
Well, Justice, if I may, with the moratorium ending, that doesn't preclude negotiating in evictions. And for example, having a process that allows for the development of a repayment plan and a catch-up plan. So there's a difference between, okay, the moratorium ends, you got 3 months rent due today, and the moratorium ends, but we're going to work with you through a mediator to have payments that can be made over time that get you caught up. But again, this would require the ability to pay mediators. Is that accurate?
Yes, sir. That's right. I'm not suggesting that there isn't value in mediation. I think, although some have suggested during the course of comments to the court that some mediation programs might not work, the fact of the matter is mediation is a very successful method to resolve parties' disputes. And I think the mediation would be very helpful at any time, but in the absence of having dollars to pay mediators, we wouldn't have them available to be able to effectuate that effort.
One can hope for additional federal aid at the very least.
I'm sorry?
I said one could hope for additional federal aid at the very least.
Yes, sir.
I'm just curious, Justice, in the event that we hit January 1 and there's still a need, what would be I'm realizing I'm just asking this on the fly, but if we say wanted to try, if we wanted to try to continue it, we couldn't with CARES dollars because it has to be spent by, then we couldn't pay for an extra couple of months of mediation now that would go over December 31st?
I'll defer that question to the Treasurer's office and to the Governor's office, but my understanding is that the way the coronavirus relief funds operate, they must actually be spent by the end of the year. They cannot just be encumbered, which is what creates the pragmatic problem for the that I've outlined.
Thank you. That's my understanding as well. Other questions of the committee?
Chair, I had a question.
Assemblywoman Benitez Thompson.
Thank Thank you so much. So as I'm reading the rules, Justice Hardesty, so the either the tenant or the landlord will initiate the process, and then within it looks like with pretty quickly, people are going to be provided information about the mediation and about engaging in the mediation. But for the people who participate in this program, what do you imagine that this will look like? Do you imagine it's just a one and done type of mediation meeting? Do you imagine that there's multiple follow-up meetings? For those of us who are less savvy about this process, and as we talk about this process, what should we lay out for that expectation of kind of a timeline?
And good morning, Assemblywoman. The thought is that, as you will recall under Senate Bill 1, there is a 30-day stay in the eviction process in order to allow or accommodate the mediation to occur. That does not mean that the mediation would be limited to one session, but it certainly means that an effort would be made to reduce the number of sessions if the answer to the problem is just getting access to relief funds or unemployment compensation that can pay outstanding rent and resolve that issue. It is entirely possible that a combination of things would take place in the course of the mediation that might require more than one or two sessions, but it is expected to not exceed a 30-day period, the course of the mediations. And that would be the extent of the stay that was authorized in Senate Bill 1. So you can see in the rules, for example, there's some fairly tight notification and communication periods. And I want to express my appreciation to Home Means Nevada and their personnel for assisting us in setting up portals that will help facilitate this.
Any other questions?
Mr. Speaker?
Is that Mr. Roberts, Assemblyman Roberts?
Yes, sir. Thank you. So just one question, Justice. So we're not doing any mediation now based on the moratorium and that we're not putting any evictions into court. I mean, could that change? Could you use the resources that you have available and the access to relief funds without the moratorium if people were just willing to go to mediation, or is there something stopping that?
Hi, Mr. Roberts. Thank you for the question. There are two mediations that are taking place. One is the voluntary program, sort of pre-court mediation program that was established by the Las Vegas Justice Court in collaboration with the Nevada Neighborhood Justice Center. That's a voluntary mediation program where tenants and landlords voluntarily participate. There aren't a lot of statistics, but there are some statistics based on the latest or the last communication we had from the Las Vegas Justice Court. And interestingly, most of the requests for mediations were coming from landlords. And we encourage that. We definitely encourage that because it's a process that helps facilitate and match up tenants and landlords with relief dollars. And so we certainly would urge that and promote it. This particular mediation program applies and is mandatory when the parties invoke the court process. I will say that there's a lot of effort taking place in the courts around the state. These rules mandate a requirement of a communication at the clerk's office But I know that legal aid organizations, landlords, tenant organizations are all doing everything they can to get people to voluntarily seek access to these dollars and resolve these issues before they ever get to court. As for what will happen on October 15th, it's a bit unclear. Reasonable people might differ about the application of the CDC moratoria. There's no further moratoria from the governor's office. So as a consequence, there may be cases coming to the courthouses after October 15th that would warrant mediation or to which mediation would be sought. But I will say that the wording in the CDC regulations seems to extend the moratoria to a tenant who submits an attestation or an affirmation of about 8 or 9 subject matters that are listed in the regulations. And as long as they do that, there's a prohibition against summary eviction or other types of evictions.
Thanks, sir.
Yes,
Other
sir.
questions? I don't think that I see any other questions. I'm looking. No. All right, Justice Hardesty. Well, thank you again for presenting this background information, and we'll certainly be on the ready in case there's a change in direction from the federal government on flexibility or relief or extensions with what we do currently have.
Thank you, Mr. Speaker, and thanks to the legislators for their assistance and their work on this. And we'll be happy to provide you as many updates as we can.
All right. Thank you, Justice Hardesty. We will now get back to item 4 on the agenda, and this is review of uses of coronavirus federal aid allocated to local government. I believe we make sure that we're going to kick it off with NACO. I have a list of speakers here. But is that correct, Ms. Jones? We have NACO first. Oh, here we go.
Mr. Chairman, the first presentation under item 4 is Nevada Association of Counties, and Dagny Stapleton and others may be joining her as well, but she is leading that presentation. Thank you.
Great. Thank you. BPS, if we could queue up Ms. Stapleton, we will start off with NACO.
Thank you. Go ahead.
Good morning. We see you, Ms. Stapleton. Thank you for being here.
Morning, committee members and Mr. Speaker. Thank you so much for the invitation to present today. Dagny Stapleton, Executive Director of the Nevada Association of Counties. And I have a presentation. I'll go ahead and share my screen. Alrighty, can everybody see my presentation?
You had it, but we lost it.
Yeah, it was up and then it went away.
Can you see it now?
No. It's still a camera on you.
Mr. Chair, this is broadcast. Permission to assist?
Please do.
Thank you. Ms. Dagny, I do see your presentation on my end. Fantastic. Go ahead, please.
Okay, so everyone can see it? Okay, thanks so much. Thank you for the assistance. So again, Dagny Stapleton, on behalf of the Nevada Association of Counties, NACO, as you all know, is the statewide association that represents all 17 of Nevada's counties. And NACO followed the CARES Act very closely from its inception until it was passed this past spring. Prior to that, our members communicated regularly with our congressional delegation about the importance of federal aid to counties and the impact that COVID-19 would have to county operations and demands on county services. So since the passage of the CARES Act, NACO has been following the Treasury guidance closely and working with our members on how they are using the dollars that they were allocated. This slide shows the county allocations from the CARES Coronavirus Relief Fund dollars. Clark County received an allocation of $295 million directly from the U.S. Treasury. The remainder of the counties received Coronavirus Relief Fund dollars through the state from the state's direct federal allocation. I believe that the committee has or has seen those numbers for how those funds were distributed to each of the local jurisdictions outside of Clark County. Washoe County's allocation was $20.5 million, and the total rural county allocation was $46.8 million. Every county in Nevada provides regional services to all county residents, and the services counties are providing during COVID-19 are really as important as ever to Nevadans. Counties always have had a role in public health. They also provide regional emergency response and support to the most vulnerable in our communities. It is many of these functions that counties have used their CARES dollars to support. So just a brief summary there. Every county has been helping to supplement public health efforts, either directly or in partnership with their public health district. During COVID-19, all public health entities are currently supported in some capacity with county funding. Counties have directly sponsored or coordinated local testing efforts, have provided staff and dollars for contact tracing and case investigation, and some in partnership with or through their county boards of health have undertaken rigorous communication and outreach efforts to residents about the importance of social distancing, wearing masks, getting tested, and complying with and enforcing the governor's directives. As most are aware, Clark and Washoe counties have public health districts, but outside of Clark, Washoe and Carson, all Nevada's rural counties have county boards of health that partner with the state to provide public health services. Carson City has a highly successful model where their health district is a part of their county and have a regional partnership with 3 neighboring counties to provide public health services. This Quad County Coalition was one of the first to begin planning to support mass vaccination when the time comes. Parts of that effort also were supported by CARES dollars. During COVID, emergency response was also coordinated at the county level, and many counties have set up emergency operations centers. Counties have also provided locally for quarantine and isolation beds for first responders, at-risk residents, and the homeless. Counties have always been the provider for local social safety net, critical services during COVID-19. All counties provide meals to seniors through their senior centers and have coordinated new or expanded systems for meal distribution and pickup. Counties also are supporting residents by connecting them to or providing them with rental and utility assistance, and have stood up programs using CARES dollars to grant money to local businesses impacted by COVID. And counties, I just want to note, have done all of this while maintaining the other critical services that they provide, including providing municipal services in all unincorporated areas, administering elections, providing critical infrastructure like roads and water systems, providing child protective services, justice and district courts, CAs, and public defenders. So they're ensuring that our local justice systems are also continuing to safely operate and providing services during COVID as well. So as you will hear, many of these services have been supported with the CARES Coronavirus Relief Fund dollars. So Clark and Washoe County will follow my presentation and provide details on how they are spending their CARES dollars. And I will provide a summary for the rural counties. But before that, I wanted to briefly share with the committee a few of the things that NACO has done to assist counties in spending their CARES dollars responsibly and meeting all the federal criteria. For those counties who received the CRF dollars through the state, NACO has been in regular communication with the governor's office and the governor's finance office regarding the distribution of those dollars, initially to advocate for the state allocation being shared with counties, and since then to ensure that all the counties are communicating with the state on their allocations, including their funding plans and their reporting. We want to thank the GFO for their accessibility and their assistance over the past few months. They've been really great to work with. Early this summer, NACO developed and distributed materials for our members that included summaries on the CARES Act and allowable uses of the Coronavirus Relief Fund dollars. We also hosted a training for our members that reviewed the federal guidelines for spending the dollars, the accounting requirements, and some audit considerations for local governments. We've made every effort to encourage and assist our members so that they will spend their dollars responsibly and in full compliance with the federal guidelines, which we believe that they are doing. Finally, in July, NACO began working with a national nonprofit, the National Development Council, on a program that counties could use to distribute CARES dollars to the small businesses in their communities. We rolled out this small business grant program in early September, and it is ongoing. The program was modeled after Clark County's program and was made available to the other 16 counties. 8 counties are currently participating in our program. 2 have their own program, and Clark County, of course, was the first to put their program in place in early summer. Through the program, Coronavirus Relief Fund dollars are currently being distributed to small businesses in Nevada for things like PPE, rent, utilities, retrofits to comply with social distancing, and operating expenses. So the requirement from the governor's office was that in order to receive their CARES allocation from the state, all eligible local governments had to submit a spending plan for both the first and second half of the amount allocated to them. Of Nevada's 15 rural counties, 14 of them chose to receive the funds. All but one of those counties have received the first half of their allocation and have confirmed that all of those dollars will be or already have been spent. About half of the rural counties also confirmed that they have plans, most already approved by the governor's office, to completely spend the second half of their allocation, and some have received the second half of their allocation as well. So the remaining counties will receive the second half of their allocation on a reimbursement basis. This is to ensure that any unused funds stay with the state, and if unused, can be allocated to other jurisdictions or other needs. What you'll find in terms of expenditures of county CARES funds is that large or small Nevada's counties support all Nevadans in similar ways, especially during COVID. Most rural counties have allocated dollars to conduct or assist with testing and contact tracing, and all have spent dollars on regional emergency response, and of course to sustain county operations during COVID, including for new and unplanned expenses as a result of the virus. Some of those expenses include improvements to ensure that employees can work safely and that the public can safely access county buildings if needed, and for important services. For purchases of PPE, not just for county employees and emergency personnel, but also to distribute in some communities. Costs for working remotely and to provide additional county services online. And changes to operations, for example, for justice and district courts. And of course, counties have used these funds to maintain their responsibility to meet open meeting law and allow the public to participate in the local government process, either remotely or at a social distance. Another common use of funds in the rural counties is to support additional childcare and recreation programs for kids who may be distance learning and need more support during these times. In over half the rural counties, this has been done through partnerships with the Boys and Girls Clubs. Rural counties have also chosen to share dollars with rural hospitals and school districts, and have provided additional support to residents in need, including nutrition, rental and utility assistance, and as mentioned, assistance to small businesses. So I want to highlight just a few rural county spending plans in detail today for the committee. And I wanted to start with Carson City. This is one of the largest rural counties and Nevada's only consolidated city county. They have a population of approximately 55,000. Carson City received an allocation of just over $10 million. And as of last week, they had received their entire allocation from the state and confirmed that they are on track to spend all of the dollars by December 30th or before. $1.6 million of their allocation is going to their school district and charter schools to assist with social distancing, distance learning, and public health needs in schools, including supporting school nurses. $1.8 million is being allocated to the Carson Tahoe Hospital, in part to support a temporary structure for any overflow due to COVID. These dollars are also supporting additional nurses and to provide COVID-19 screenings. $1 million is being provided to nonprofits with a focus on supporting students and residents in need, again in a collaboration, I believe, with the Boys and Girls Club in Carson City to provide additional services to kids. And then parts of this $1 million are going to community organizations impacted by COVID-19 as well. Carson City used $1 million to set up a PPE supply depot. So this is a place that local businesses can come to get free PPE and sanitation supplies for citywide distribution. Carson allocated $200,000 for long-term care facilities, specifically to a retrofit for a social distancing improvement project at a local facility in order to create the ability to isolate exposed or positive residents. And then the balance of Carson City's funds went for operations, including retrofits in city buildings and facilities, regional emergency operations and public health, as well as contact tracing and testing for the Quad County public health response. Nye County is also one of Nevada's larger rural counties with a population of 46,000. Nye County received approximately $8.5 million. They have received the first half of their allocation, and earlier this week we're expecting to receive their second half. They confirmed that they have planned for and will have expended all of their funding by December 30th. They allocated approximately $700,000 to public assistance, including food distribution and rental mortgage and utility assistance for residents. County staff reported that this has been one of their most successful CARES programs to date in terms of being able to get those dollars quickly out the door to meet local needs. Also, based on recent increased needs, the county is looking at a program for mental health assistance to residents and may plan to use a portion of their CARES dollars for that. $1.2 million in Nye County's allocations went to sub-entities, including PPE for their school district, COVID-related expenses for the public hospital in Tonopah, and expenses at their towns and libraries for PPE, retrofits, and changes to operations during COVID. They allocated over $1.5 million to small business assistance, including rent, operating expenses, retrofits, et cetera. They are participating in NACO's small business grant program. And the balance of the dollars went to county operations, including their public health efforts. That actually includes $100,000 that they've spent on community-based testing and contact tracing. They're also spending some of those county dollars on emergency response, PPE, telecommuting expenses, and other measures taken in response to COVID-19 to maintain services to the public safely. So finally, I wanted to provide the committee with information on just sort of as an example on how coronavirus relief funds were spent in two of Nevada's very small frontier counties. Both counties have populations under 10,000, and these dollars have been very helpful to those counties and their residents, and they report that they will, of course, spend their full allocation by December 30th. Of the $900,000 that Pershing County, they used those dollars to pay for increased costs for emergency operations, including equipment to mitigate potential exposures, and a trailer for response in rural parts of the county. In partnership with their hospital, they paid for community-based testing events, as well as made sure they could provide long-range testing into the winter, and they got set up to administer vaccinations. They've also purchased PPE and cleaning supplies and made other purchases to ensure that they could socially distance and manage any outbreak were it to occur at their county jail. They will spend some dollars on public safety and public health salaries, dollars to support remote meetings and other county operations. And finally, they are supporting COVID-related changes in programs for their seniors and some small retrofits to their community center to allow the use of that for hospital overflow if needed. And White Pine County spent approximately half of their dollars on, they received $1 million and spent approximately half of their dollars on county operations and response, including public health, emergency services, ensuring that their courts can operate safely during COVID, and to provide additional meals to seniors. The other 50% of their dollars were allocated for grants to support small businesses. They're one of those counties participating in NACO's small business grant program. They're also supporting programs for students and assistance to the White Pine County Fire District for additional supplies for emergency response. Thank you, Mr. Speaker and committee members, again, for the opportunity to share this information. I'm happy to answer any questions and also provide any additional information that the committee might request.
Thank you, Ms. Stapleton. You had mentioned earlier that the second half of the allocations are going to be made based on reimbursements, so that if some of the funds are not spent, the state can use it elsewhere.
Yes, thank you for the question, Mr. Speaker. So that actually is only a handful of the rural counties are receiving the second half of their allocation by reimbursement. Many of them had a plan for the second half of their allocation and already have planned for and even received those funds. But yeah, for those counties that are just have decided to receive the second half of their allocation by reimbursement, yeah, they're doing that to ensure that they don't have to send money back to the state if they don't use it all, even though some of them will likely use it all and are planning to do that. But they want to make sure that if the funds go unused, they're already with the state so they can go to other jurisdictions or other needs that the state may decide to use those funds for.
Thank you. That I think speaks to my question. I just want to make sure if the allocations were made by population, it would be permissible to use it in a different county if one county didn't use it. There wouldn't be any restraints on the ability to allocate it to a different county.
Well, for the counties that receive their allocation from the state, I believe that's a decision made by the state. And I believe, yeah, they absolutely would have the ability to do that. That's my understanding of the Treasury guidance.
Okay, so it's a state determination, not one created by the federal allocation directly.
So for those, well, I think the rules are the same, both for the direct federal allocation and the state allocation, and then the allocations down to counties. Counties could allocate to other entities within their jurisdictions, but if they have unused money that, for those states that receive money from, for the counties that receive money from the state, if they have unused funds, those funds go back to the state. It would then be up to the state within the Treasury guidelines how they want to use those funds.
Thank you. Thank you, Ms. Ableton. And I had also noted earlier when you were going over the different programs that were being funded, the different uses by local government, there were allocations impacting schools, healthcare, rental assistance programs. All that stuff is great, but it seems that some of that seems to overlap with state expenditures along the same lines. And so I just wondered what coordination, if any, is taking place so that we're not duplicating efforts with respect to schools and, you know, the other areas where, like I said, healthcare, things like rental assistance. How are we making sure that we're not, you know, duplicating efforts or, you know, coordinating as best we can?
Thank you for the question, Mr. Speaker. So regarding the schools, I can't speak specifically. I think that would be a question for the individuals.
I think we lost you there.
Can you hear me? Can you hear me?
I can hear you now. Thank you.
Okay. Regarding the allocations to schools, I know that school districts also received CARES dollars, and I would hope that if they're requesting money for those counties, it's not for things they already received other dollars for. I would assume that that's the case. And each county worked individually with their school districts on what the particular needs were over and above, assuming other funding they had for those school districts. So those costs vary in each county depending on what the school district's need was and the county, how the county wanted to help. In terms of the health response, so every county is coordinating differently on the public health response. So there are, of course, local responsibilities through the health districts for the health response. In the rural counties, the counties work with the state and also provide public health response on the local level. So in every one of those instances, there is coordination between the state and the counties on who is doing what. From our perspective, it's important to note, though, that a lot of the counties, even the smallest rural counties, are participating in that and are spending county dollars and CARES dollars on testing and contact tracing. So in that instance, I believe, because there's so much need, I'm not sure there's duplication, that there is partnership to ensure that that the need is being provided, and I don't believe it's being duplicated in terms of the public health response. I'll speak, I'll leave to Washoe and Clark to speak about their assistance programs, rental assistance and things like that, but I will speak on behalf of the rural counties. So aware that the state is providing rental assistance through I believe through the Rural Housing Authority. And so I believe what most rural counties are doing are referring folks to that program. I think in that instance, there's so much need that for those rural counties who are providing that assistance individually, which a few of them are as well, that is still meeting an important need. And I'm not sure that there's duplication there. The grants to small businesses, that's a program that we have been working on for months. And so that program has been rolled out. We have communicated with GOED and the Treasurer's Office, and they are aware that we do have a county program for that. We know that the state's rolling out a similar program, and the request that we made there was to ensure for those counties that have existing business assistance programs that we work together to make sure that small businesses aren't confused and that all those funds are being used. Did I cover everything that you asked about, Mr. Speaker?
You did. Thank you, Ms. Dickerson. I believe I have a question from Assemblywoman Tolles.
Yes, thank you, Mr. Speaker, Mr. Chair. So I noticed that as you went through the presentation, only Carson City specifically allocated $200,000 for long-term care facilities, and yet we know that that's where we have oftentimes our highest morbidity rates. And I'm just wondering if it's because typically those CARES Act allocations are coming directly from the state to our long-term care facilities. And I think along the lines of the questions of of our chair, are we making sure that we're coordinating with the state to ensure that we're getting those much needed resources for our vulnerable populations?
Assemblywoman Tolles, thank you so much for the question. So, as you know, that the long-term care facilities are regulated by the state, that is a very vulnerable population. And there's, of course, a need there to support those folks as a part of the public health response. And I think in the instance of Carson City, there was a need. They put out a call for what are the needs in the community when they received the CARES dollars. So they sort of asked for who needed assistance, and they heard from one of the long-term care facilities that there was a need, and so it was Carson City's decision to allocate those funds. So I have not heard if there are any other counties sharing funds with long-term care facilities. I don't believe that there are. It may just be the case where in Carson City, that facility asked and knew that the local government had those funds, and the local government decided to share them. So I think it's just a case of every county deciding individually based on the needs that are elevated to them and other priorities. And then I can't answer whether the state is also supporting long-term care facilities with their CARES dollars.
Right, thank you for that. And if I may ask just a couple follow-up questions. Also wondering if any of these dollars were used to help with first responders. I know that we had some specific programs that we looked at to provide opportunities for first responders or really anyone in the population who needed a place to isolate away from their family to help reduce community spread. So we had certain programs set up for paying for hotel rooms, for example, so that they could isolate for the 14-day period of time. Are you aware of any of the counties utilizing these CARES Act funds for that? Or was that something that was through, again, the state directly or maybe city programs? Because I know that that was another need that these dollars could be used for to help, again, reduce the community spread.
Thank you, Assemblywoman Tolles, for the question. Yes, absolutely. Counties provide the regional emergency response, and of course, a lot of those first responders are county employees. And I'll let Clark and Washoe answer that question specifically for them. I do believe that they did set aside some dollars and did provide quarantine for first responders. And I believe that there were a few of the rural counties that did that as well. I don't know off the top of my head, but absolutely that was a need that some of those dollars were used for. Thank you.
Further questions?
Mr. Speaker, Senator Glickachia. Thank you, Mr. Speaker. Ms. Stapleton, we had a conversation 3 weeks ago, and has the participation picked up in these small business grants? I know you were kind of concerned it wasn't rolling out as fast as you thought it would. And of course, I've been in contact with Director Brown as well as Treasurer Conine and the new program they're rolling out. I know there are a lot of people anticipating that application and because of its simplicity. So any response to that? How much participation are you getting, especially in the rural counties?
Thank you, Senator Glickachia, for the question. Yeah, we worked really hard to roll that program out, and in the rural counties used all sorts of outreach. Even in some counties, we had commissioners going business to business with those flyers. And yeah, the participation and interest in that program, so it took a couple weeks, but has picked up. And in conversations with, I haven't seen the state's application, but I know that they looked at our application, and I'm not sure how much more simple it will be. We do think our application is pretty simple, and we made sure that there's a sort of any and all allowed uses that the Treasury would allow for CARES funds, those businesses can apply for. So we tried to make it broad and not complicated and simple. So we hope that that's not a barrier. And again, are contracting with what I believe, and I know the state will correct me, I believe that the state for some of those programs is using the same contractor we are. So I'm not sure how similar our applications may be. But yeah, short answer, we are seeing significant interest in that program now, and lots of communication on the local level with businesses to get the word out. For participating counties, again, it's only 8 of the rural counties that are currently participating in that program, and then 2 of them have their own individual program. So some of the rural counties, their program is not available, and so I know they'll be looking forward to the state program.
Thank you so much, Dagny, Ms. Stapleton, and I am glad to hear it is rolling out. Thank you.
Thank you. Other questions of the committee for Ms. Stapleton?
I guess, Speaker, I have one final one, but it kind of fits in with the theme of along Senator Glickachia question about kind of different programs being offered by the state, similar programs being offered at the county level, and kind of how the application process might dovetail. So I kind of have the same question along the rental assistance line. If the counties were developing each their own process to determine who would qualify rental assistance, if you were using another county's established process, or if if we had, I'm just trying to get a feel for how many different types of ways people might be able to apply to qualify or not qualify for rental assistance.
Thank you, Assemblywoman Vegas-Thompson. I appreciate the question. So specific to rental assistance in the rural counties, and I know the urban counties can speak to their programs individually, but specific to rental assistance in the rural counties, I believe that there were 2 counties that offered individual rental assistance, but the majority of those counties are when when there's residents in need in our counties, a lot of times their first stop is to the county human services departments. And so in the rural counties, when those folks reach out looking for services, specific in this example to rental assistance, the counties will then defer those folks to the state's program. So in the rural counties, for the most part, they are coordinating with, again, I think it's the Nevada Rural Housing Authority who's providing the rental assistance in the rural counties. And so they will direct those folks, perhaps even help them with those applications to the Rural Housing Authority. so that it's sort of a one-stop shop there for those folks. I don't believe there's really a lot of duplication and that there is coordination. And for the 2 counties that I believe are providing rental assistance, I can check, but I believe that they also have a pretty close relationship with the Rural Housing Authority and so are likely coordinating there.
Okay, thank you. I appreciate that. So they're just helping them with the referral and helping them probably have dedicated staff members, or I don't know how they're specifically budgeting the money, but some way that would be helpful in connecting the folks to the state programs. And that's the way that fits rental assistance.
Yes, they would, the existing county human services staff, even prior to the pandemic, that's something that they would do. They would refer folks to services, whether they have them in the county or to other organizations. So for rental assistance, the rural counties are referring those folks to the Rural Housing Authority and assisting them in that way, making sure they're connected.
So they're not doing it. When I hear rental assistance, I should just know in my mind, they're not doing an additional pot of money. They're just helping with referrals.
So again, for the rural counties, Assemblywoman, I believe that there are 2 that are doing additional assistance, but I'll find that out for you. And the rest, yeah, they are not duplicating the state's program. That program rolled out months ago, so they were all aware, and they're just referring. So there's not duplication there. But I'll find out on the 2 that are, and just make sure and provide that information to you.
Okay, thanks.
Thank you. And Ms. Stapleton, I think to wrap it up, the question that I think we feel compelled to ask everyone today in particular is, how confident are you that we won't have a situation where there's remaining funds that aren't expended by the end of the year? I realize that some of the counties on a reimbursement level would have time, but aside from, I think, budgetary concerns about just being able to spend it, I don't want to get caught where we have a window of time between a local government making a request for reimbursement and the processing of it. And, say it's December 30th and all of a sudden we are running the risk of not having it actually expended. How confident are we that we have systems in place to make sure that it's not anything left over that gets caught in that and isn't able to be expended by the state by the end of the year?
Mr. Speaker, thank you for the question. So that's been something that we have been talking to our members about since this summer, since the dollars were rolled out. We've been stressing to them to make sure to come up with a plan for how you're going to use them. And that if they think they cannot use their dollars, to make sure that if they know that, and if they need to return them to the state, that they can do that so that there are no dollars left on the table. That's something that we've said, especially to our rural members, repeatedly to ensure that that won't happen. And I can say that when I was preparing for this presentation and just in conversations before that, I did talk to every one of the rural counties and ask them where they were at and do they expect to use all their funds? And the answer was, from most of them, a resounding yes. They were grateful for the funds and absolutely they will be spent and they are on track to do so. I know the governor's finance office is working hard to do that also. So, but why I mentioned also the counties that are receiving their second allocation on a reimbursement basis, that's important because for those, there are a few counties that think that they may not spend all of their allocation. And if that's the case, they have requested to do reimbursement so that they don't even receive those funds unless they are sure they can spend them for that second pot of dollars, so that those funds stay with the state. And again, the state could then use them for other needs. So I think the answer is yes. The monies that the rural counties have will be spent, and we are working with them to encourage them and ensure that that happens.
Thank you. And I just kind of want to put it out there to make sure that they are aware if the state gets backed up into a corner and has not received a request for reimbursement, that there's an understanding that the closer you wait to the end of the year, the more likely the state's going to use that for something else. So I kind of just want to make sure everyone is aware. We don't want to run the risk of not being able to. So whatever the state ends up having to do, if there's some money left over, that hasn't been claimed for reimbursement. I just want to make sure they're aware that it may not be there. So if they wait and then they have an expenditure and then request a reimbursement, that if they wait too long, it may not be there to reimburse them.
Yeah, thank you, Mr. Speaker. We have been, again, stressing that message to them that that it's important to get their spending plans in and spend their money, and that if they don't spend it, the state may spend it elsewhere, and they are aware of that. But they also are grateful for the funds, and they are spending them. So,
Any other questions of the committee? I don't think I see anyone waving. Okay. Well, thank you, Ms. Stapleton. We will look forward to being in touch about how that all is flowing and progressing towards the end of the year.
thank you. Thanks so much.
Thank you, Ms. Stapleton. I'll now move on to Clark County and ask if BPS can connect. I believe Ms. Joanna Jacob from Clark County that's going to kick off the presentation from Clark County.
Yes, good morning, Mr. Speaker, members of the committee. Joanna Jacob, Government Affairs Manager for Clark County. I have in the room with me County Manager Yolanda King, Assistant County Manager Kevin Schiller, and our CFO Jessica Colvin. On the phone, I have Deputy Chief Clark County Fire Billy Samuels, who's just there for phone a friend if we need him to answer any questions about our emergency response. And I'm going to share my screen. We have a presentation today starting with Clark County, but then it will be followed by our municipal partners who received funding from Clark County. So let me do that, and I'll just tell you, we put this together to try and keep it the time. I know that we have a lot to cover, and that we wanted to make this kind of flow so that you would see how we are spending our funds and then what the cities did with the funding they received. So let me.
Well, Ms. Jacob, I appreciate that. I think I would suggest then that members get through the entire presentation and then they can make take some notes to ask questions when you're done, just in case it's going to get answered later in your presentation.
Hold on one second. I was testing this with broadcast services. My apologies, Mr. Speaker, but let me try and go back to the beginning here. Well, I'm going to the end. 1 second. Broadcast services. Hold on. Let me see if I might need some assistance. Let me stop the share here. I'll go back to the beginning.
Should say it.
Go to the top. Click the first one. The first
There you
one.
go.
From the beginning.
There you go.
Okay, we're back on track. Okay, Mr. Speaker. So as I noted, we are presenting together today with the cities. I wanted to briefly, I know you're very familiar with Clark County, but just very briefly make a note here. We are the 11th largest county in the nation. We cover both municipal, we cover regional services and municipal services for our 2.3 million residents. If our unincorporated area was a city, it would be the largest populated city in Nevada. You heard Ms. Stapleton talk about regional and municipal services that counties provide. I wanted to just kind of show you what this looks like in Clark County. And certainly you're going to see this as we talk about how we allocated our funding. We divided it between regional services because that's where we saw the most impact from COVID-19, and the municipal services that we have to provide to our 1 million residents in unincorporated Clark County. I will point out that our regional services for Clark County does include UMC. I also want to point out when we talked about how the county was impacted by the COVID-19 pandemic, we took a look at the numbers, and I'm sure everybody is well aware that the concentration of the cases has really tracked with the concentration of the population of the state. These numbers are October 5th, just this week, that of the 82,400 approximate cases in Nevada, 69,000 of them are in Clark County. And you can see the demonstration here. This has really been a constant rate that we have that has caused a lot of impacts in Clark County. I also wanted to include this heat map. I know we are presenting with the cities. So for the Southern Nevada legislators, you can see that we still have areas by zip code that are particularly impacted. This is the zip code that we have mapped that we were able to access earlier this week. We still have many areas that have cases numbering over 22,600. I guess you can see that's the red area. And the orange areas, you can see between 1,327 cases to 2,261 cases. Just wanted to put this in for context as we go through and we talk about how we used our coronavirus relief funds. This is just a brief narrative of our timeline. We received direct allocation, as Ms. Stapleton noted. On May 19th, our Clark County Board of County Commissioners had approved an allocation of the coronavirus relief funds and how we plan to use those funds. The priorities for the county included really our regional services and direct emergency assistance for the entire region. We cover a region of 2.3 million residents, and we wanted to maximize the support for our community. That includes Assemblywoman Tolles. I know Mr. Schiller will go into this later, but we have allocated housing towards our first responders, and certainly that was an important thing that we did early on. We subsequently, as you're aware, the state of Nevada provided their allocation, but the cities of North Las Vegas, Henderson, Mesquite, and Boulder City were excluded. So in the absence of the state funding, those municipalities, we've been working with them to assist them with their respective COVID-19 costs. So we took that item back to our board, and our board allocated funding from Clark County share to the cities, and that happened on July 7th. So I am going to hand it over to our CFO, Ms. Colvin, and she can kind of walk you through, and this chart represents the reallocation of the funds after reallocating to the cities.
Thank you, Joanna. For the record, I'm Jessica Colvin, Chief Financial Officer for Clark County. I'm going to provide a summary, a table of how the funds were allocated. And the Board of County Commissioners, at the time the funds were awarded to Clark County, the $295 million in relief funds, they determined that the needs of the community required a regional approach, both to the public health crisis, and that would be through our multi-agency command center and our county hospital, as well as a regional approach to the economic crisis through our social service and human service programs. Mr. Schiller and Ms. Jacob are going to provide some details on these line items, but a couple of things I wanted to point to your attention. On the third and fourth line of this table, the emergency medical care and the rehabilitation care, those line items are specifically designated for a medical surge facility and rehabilitation care facility in the event our hospitals in Southern Nevada reach or near capacity. Early on, we were approaching that. Our team, between the county hospital and our fire department, had designed a plan to stand up a 900-bed medical surge facility. That was not required at that time. However, we are prepared in the event there is a resurgence or a second wave to stand that facility up. Right now, you can see that we have allocated approximately $21.5 million for those two facilities. The total cost of that would actually be about $34 million. And so you'll see later in the presentation that we had allocated some of those dollars to help support the 4 cities that received the relief fund allocation from either the Treasury or the state. And we have an agreement that in the event a med surge is needed or required, that those cities would help support that. And provide some of their relief funds to help support a regional med-surg facility. If we keep going to, I think, the next slide, Our additional regional cost is, like Ms. Stapleton noted, we also in our regional facilities and regional services needed additional IT infrastructure and equipment, not only to provide virtual teleworking, but also the ability to provide services virtually wherever possible within our regional services. And any building modifications would be similar. These would be retrofits, social distancing within our regional facilities. And I think it's important that of the $295 million that was allocated to Clark County directly from the Treasury, the $208.4 million is designated for services to all 2.3 million residents. And of course, that's going to include the 1 million residents in unincorporated Clark County. But these services are also provided to the residents of the City of Las Vegas, Henderson, City of North Las Vegas, Mesquite, and Boulder City. The Board of County Commissioners also allocated relief funds for our municipal. So similar to cities, we provide services to our 1 million residents in unincorporated Clark County. Our business license program, what this really is for enforcement, to enforce either closures or adherence to the governor's directives. Again, we also had building modifications that were required in those type of municipal facilities, such as our parks and rec facilities. And then we also have, similar to the rural counties, economic recovery programs for our small businesses. And these are programs designed specifically for those small businesses located in unincorporated Clark County. And as Ms. Jacob noted earlier in her presentation, the 4 cities that did not receive the allocation of relief funds, they provided to the county kind of what their needs were in their respective jurisdictions. And we were able to allocate $57.1 million across to those cities, and we allocated that $57 million based on their proportionate population to one another to arrive at the total allocation of $295 million. This is just to give you a snapshot of how the allocation was provided to those 4 cities, again, based on population. In that third column, the amount held until November.
Oh, I'm sorry. Oh, what did I do?
You have to go up, press on the keyboard.
Oh.
We're going.
Yeah.
Sorry about
Thanks.
that.
Sorry about that.
That third column is what I was referring to earlier. So, for example, for the case of Boulder City, yes, we allocated $1.5 million to Boulder City. We did request that they hold $300,000 of that allocation until November 1st to ensure that there was not a need for a med-surg facility. If there was, then they agreed that they would contribute that $300,000 to the facility. In these subawards, the 4 cities are responsible for adhering to the Treasury guidelines. Again, any unspent funds are to be returned to the county, similar to the rural counties, who provide them to the money back to the state. We've come up with a deadline of the beginning of December, so any unspent funds by that date would be returned to the county unless they can show that they have obligations in place through the end of the year. And this is to give you a snapshot of kind of the county spending to date. This is through September 30th. You can see we're about 50%, we've obligated about 50% of the funds. Outside of the subawards to the 4 cities, the response and mitigation efforts are our largest expense at this point, which makes sense because that was early on our focus. Over the last couple of months, we've been working towards direct assistance to the recovery efforts through rental assistance, utility assistance, food assistance, which is making up that $36.2 million. And our business recovery efforts within our unincorporated area totals $2.4 million to date, but that program is continuing and applications continue to be processed. From there, we'll turn it over to Ms. Jacobs.
Yes, thank you. And Mr. Speaker, as Ms. Coleman noted, we're just going to highlight a few of these categories since the committee had specifically asked about what we've done with these funds and some outcomes that we can report. As Ms. Stapleton, as we've noted, the counties are responsible for their regional emergency response. So we set up our multi-agency command center, our MAP, supports our entire region. That effort is led by our Clark County Fire Department and Deputy Chief Samuel, who's on the phone. As part of that effort, we worked on logistics, really, as everybody struggled with accessing PPE supplies in the early days of the pandemic. And the important role of the MAP really is to coordinate those logistics. We have been supplying and storing, actually, supplies for the entire area. During that time, we've been staffing a warehouse 5 days a week, and we really were doing that to address kind of ongoing need for the entire community. As I think Ms. Colvin had mentioned this, our med-surg facility planning, we had planned at one point up to 900 beds. That is a med-surg that can be opened up in phases, beginning with 150 beds, and we are ready and still ready to do that if we see a second wave. We did enter into a contract with LBCDA to have that med-surg facility there if needed. The important thing I think that we did, and this is a really this is really something that we wanted to highlight. We coordinated daily testing sites in Southern Nevada, and this was with a partnership with the National Guard, and UMC actually has been supporting this whole entire effort, along with our Clark County employees. It is open to anyone. And as part of this effort, we also stood up a high throughput testing lab at UMC. It actually is supporting the entire community. And really, this has been kind of a game changer for Southern Nevada once this was up and running. As you may recall, there were early on in the pandemic some challenges because we didn't have the resources we needed to do in-state processing of test results to support the demand that we knew that was coming. So a portion of Clark County's CARES Act funding actually helped UMC with their capital investment in their testing labs to do that. And they are actually, at this point, up to the ability to do 10,000 tests per day. As we've noted here, as of earlier this month, we've done 224,547 tests throughout the valley through our fixed site and our mobile units that we deployed to bring testing to our neighborhoods and communities that needed it. And then I think Mr. Schiller will talk about this next, but we really saw early on an intensified need for social services.
Good morning, Mr. Speaker, members of the committee. Kevin Schiller, Assistant County Manager, for the record. As I approach this slide, I wanted to just highlight two primary areas. One of the first issues that we saw back in March was an immediate need in the sheltering world for our homeless population and our vulnerable populations. We had closure of shelters based on positive test results, ended up working with the health district very specifically in terms of how we shifted from a congregate care setting to a non-congregate care setting, which continues today. That first bullet where I talk about our 300 plus housing units for community isolation is non-congregate, meaning that it is non-shelter. They're individual rooms with full service programming. In addition to that, we also master leased multiple hotels to respond to both first responders and that homeless vulnerable population. We did learn very early on that their needs from a medical acuity were much higher, not just from specific COVID-related symptoms, but just in general. So we also moved into contracting for an assisted living facility. So we had direct transition. We partnered with the Hilton to do 134 dedicated rooms for visitors who were in need of isolation and quarantine based on an inability to leave once testing positive. In addition to that, we contracted with Rita Suites to provide direct placement for first responders to include hospital staff and those that were on the front line based on the spread of the virus. We also partnered with the City of Las Vegas towards the Cashman Center Isolation Quarantine Facility. A couple notes there that I want to emphasize. One is, very specifically, is with the onset in March and the shifting and the reduction, we had one of our major shelters, Catholic Charities, close based on a positive result. That master leasing that I referenced previously was a direct result of that, but also this quarantine facility that we partnered with, an expended construction cost at about $5.4 million, actually served as a diversion for that hospital need in terms of medical assistance. So what it also did was serve as a navigation center to move those 300 plus clients that you see in the first bullet immediately into not just a shelter, but into a actual housing program. So we maintain that today. And as a note, we'll be maintaining that post December 30th as we move forward beyond those CARES dollars. So what else have we done tied to that? So the regional human services programs and our basic needs assistance, those grants go up to about 30 plus providers as we stand today in terms of contracts to get out and make sure we can get the capacity to meet the demand. Obviously, with unemployment, with all the impacts that we've seen across the valley here and in the region, food assistance is obviously one of those critical pieces. We did see some rise in domestic violence, so we immediately funded that in terms of our sheltering. Case management, program response, obviously tied to those 300 plus beds I spoke to earlier, but also case management, because it's not just about our homeless population, it's about those that are in financial crisis. So people that were normally working, supporting themselves, found themselves in significant crisis for access for all of these services. That leads into learning support specific to distance learning with our school district and with our current structure and distance learning. One of the things we saw immediately was a need for care for children and support for those children. So we implemented a couple different pieces with our Parks and Recreation Department to both subsidize those programs, but also increase our typical after-school programming to full-day virtual learning programs. And then another key point would be our foster parents and our kinship placements, strong supports for those placements tied to both virtual learning and impacts related to COVID. Another piece here would be outreach specific to those where we deal with child abuse and neglect in terms of reporting and in terms of outreach for structure. One of the key pieces that we saw about a month and a half in with the onset of the crisis post-March 15th was really as we rose into a code red county. As many of you have seen, you see that on national news, but at a local level, working with our coronavirus task force and the governor's office. In the Hispanic population, we saw a significant rise in terms of both numbers in terms of positivity, but also an inability to test and a resistance to access basic needs services based on fear of residency and other issues. So we initiated a mass campaign that continues today called Está en tus manos. That outreach campaign is very focused on both education related to COVID-19, prevention services, basic needs, and also assistance and testing locations, trying to remove those barriers in our highly vulnerable population. To answer a question earlier, we have directly funded testing locations within those high-risk communities so that we can ensure that people have access. Food service delivery, obviously, is another significant piece. This goes across every population from young kids. Even in our WIC program, we worked with the state initially on actually delivering food, but then moved into mass food to service delivery for anybody from children, families, all the way across to our most vulnerable seniors. Many of them remain isolated, so we expanded those services. There's been a lot of discussion, and so I'm going to try to hit this as I walk through this with some of the questions that have come up around rental assistance. So with the onset, we knew right away in terms of the eviction moratorium, people becoming unemployed in those high numbers and then tying that over to DETR and needs there, we would have a massive need. So the county allocated $30 million out of our direct CARES funding allotment, and the board directed that in conjunction with the state providing an additional $20 million to a total of $50 million. Two pieces tied to this. We initially rolled this out with 14 nonprofits. Obviously, this concept was to ensure we could meet the capacity and the need. Unfortunately, that need was about fivefold over what we had initially anticipated with those 14 nonprofits. So to give you some context of what occurred when we rolled this out, we had, I think, initially about 40 to 45,000 inquiries within a matter of days. And we're kind of engulfed with requests and inquiries. So what we eventually did is we halted the program from a processing perspective, at least on the hour communication. With those inquiries, the nonprofits have continued to do those rental assistance applications, but what we also did in that is then started immediately working with the state treasurer's office and all our partners statewide across on this program to look at our application. What we did in that application is we moved that to an attestation process to make sure we still were meeting the Treasury guidance that was coming out related to requirements. That is going to roll out again this coming week. And we have brought in about 45 full-time contracted staff, somewhere between 45 and 60 actually, for a full-time call center, but also these staff will be doing full-time adjudication of rental applications. So our anticipation with this new process, I want to kind of emphasize, is that we'll serve about 14,000 households. We've served to date about 2,700 households to a total of about 7 million. Two pieces that I want to emphasize in this that I think have come up previously. If somebody contacts the state and they're interested and they're a resident here in Clark County, they get deferred down to us for that process. Our nonprofits will also be finishing those that they have inquiries on and going to an attestation process also to expedite that process. We do believe those 14,000 households will get adjudicated, and we will not leave dollars on the table related to this direct assistance. And two pieces that I also want to emphasize around this is this direct and emergency financial assistance around rent, it's mortgage assistance, rent assistance, and then other emergency expenses. So what we're finding again is we're finding working people that have either reduced hours or in crisis. We wanted to ensure that we had a process by which to do that. The nonprofits will still remain engaged, providing holistic case management and those emergency services and direct assistance. And on utility assistance, you may have seen this. Yesterday, we ended up utilizing a payment for about $5.3 million to an upwards of 14,000 plus residents who were impacted by COVID-19 to NV Energy. Go ahead. And at this point, I'll turn it back over to Ms. Jacobs.
Sure, I'll let Kevin catch this for us. And I think this is going to be my final slide just for the committees. And then next we'll be handing it over to City Henderson. As Ms. Colvin had mentioned, we did have our Economic Recovery Grant program that is led by our Director of Economic Development, Shawnee Coleman. She's been working very early on this program and has served as a resource. I know there's been questions about how we're collaborating with our city partners and with the state. There is a great deal of collaboration that has gone on these programs. We have 3 of them. So when I checked in earlier this week with Ms. Coleman, we've done $2 million in assistance on this to date, spread out amongst these 3 programs. She is currently opening up a second round of grant assistance for our Small Business Stabilization Grant, which really funds kind of payroll and working capital for small businesses. We had a commercial rental assistance grant also that would help commercial tenants stay in their properties and also help the landlords as the payment went to the commercial landlord. The protracted retrofit grant, I do want to mention this specifically because this is an ongoing program and can be layered with the Small Business Stabilization Grant. And the intent of this program, especially, I can see this being in need, especially now as our businesses start to reopen. This is intended to help the businesses kind of create the infrastructure that they need to safely reopen. So it helps with retrofits of the building, plexiglass, PPE, disinfection programs, any kind of modifications that are needed to safely comply with the governor's directives and social distancing guidelines. One of the other things that Ms. Coleman did, we reopened, we actually saw early on the grocery store in Laughlin, actually because of the business closure and various other stressors due to the economic effects, had to close, and that really impacted the community in Laughlin. So we provided assistance allowing them to reopen. She also has partnered with Legal Aid of Southern Nevada. This is a relatively new program that Legal Aid is going to be doing some small business legal assistance to help businesses deal with the impacts of COVID-19. She's also partnered with some of our urban chambers, and they are doing kind of outreach and then providing grants to their members within those chambers, and then has worked with the Global Economic Alliance also. A lot of the key things that we can do to help businesses to help them navigate through some of these really confusing guidelines and shifting guidelines and things, especially as local and federal assistance programs come through. We're working with them to help navigate those programs. So I will give everybody a break, and I actually, at this point now, we're going to move on to the city portion of the presentation. So next, I'm going to hand it over to the city of Henderson. And Henderson, just let me know when you're ready, and I'll be navigating for you. Just tell me when you need to advance the slide.
Yeah, we're ready.
Okay.
Okay, thank you. Good morning, Speaker Frierson and committee members. My name is Ryan Turner. I'm the Division Head of Emergency Management for the City of Henderson. This first slide is really just a snapshot in time on currently where we stand. Currently, our residents, we have 325,000 residents. Since the entire period for COVID-19, we've experienced 6,514 cases. We've had 659 hospitalizations, 192 deaths. Our current unemployment rate is around 14%. K through 12, our student count is a total of 41,630. In working with the Clark County School District, we've estimated that there's approximately 931 students who are currently enrolled in the school district, but have no computer or internet access. That equates to 361 elementary school students, 74 middle school students, and 496 high school students. And currently, right now, we're working with the school district to identify where these students are located. Next slide, please. Okay, this right here is a coronavirus timeline. So in January 27th, that's when the US pandemic really started. On March 15th, the City of Henderson declared an emergency. We activated our Emergency Operations Center, and that was open for approximately 2 months. For those 2 months, we focused on really two priorities, and those were life safety and incident stabilization. Then on May 15th, we began the recovery process. We have a FEMA-approved disaster recovery plan, and that's how we formed our recovery organization. With that, we did not look at the regional assistance because Clark County was providing that assistance. We were really looking at what are the unique needs of our community. So what we did was we sent out approximately 112 community impact surveys to nonprofits, businesses, residents, and then we came up with what are those needs that we need to have a plan for our recovery plan. We grouped those into 7 main categories, and we, our senior leadership here at the City of Henderson asked us to prioritize those 7 categories. We utilized a method, a prioritization method called RICE, and RICE stands for Reach, Impact, Confidence, and Effort. Based upon that, we developed our overall recovery plan, our prioritization. Then on July 30th, Clark County awarded the City of Henderson the Corona Relief dollars. And before we move on, I just want to take the moment and just thank Clark County for providing us that award, because that award funded our recovery plan and has really been assisting our community. Additionally, we want to thank this committee, and this committee's provided resources and programs to Henderson and Nevada residents that's assisting our overall recovery. On August 4th, we implemented our entire prioritized plan with our recovery plan. And at this point, I'm going to be turning the time over to Jim McIntosh, who is our Chief Financial Officer for the City of Henderson. Jim.
Thank you, Ryan. Thank you, Speaker Frierson and members of the committee for the opportunity to speak today on behalf of the City of Henderson. This slide here reflects our total amount of coronavirus relief funds. Ryan mentioned our prioritization methodology that we used. We prioritized the funds into these 7 distinct buckets that we felt were most important and unique to our community and were the best way to deploy these dollars. The bar represents the total amount of spending that we have in each one of these buckets. The dollar amounts are there at the bottom. The total amount that the city was awarded was $29.6 million from Clark County. And you can see how we've allocated each one of these distinct categories, how much we've budgeted. The orange represents how much we have left to spend. The blue represents what has been obligated and expensed so far. And I think a common refrain that you're just hearing throughout all of this is the challenging issues we have with the time frame and getting these dollars spent and trying to get some of these infrastructures in place to push some of these dollars out that we can as much as possible. But this is just to give you a general snapshot of the buckets that were important to the city of Henderson in terms of priority and where we spent. We're approximately 30% obligated or expensed in our funds to date. Next slide, please. So we've got a slide on each one of these 7 major categories, and there are, of course, programs under each one of these categories. Most importantly, I'm not going to go through every single one of these items. If you have questions, I will certainly provide more detail. Childcare and education is something that we heard was very important to our community, has been important to the city of Henderson for a long time. We knew we were going to have to stand up an emergency childcare at some point between many of the non-essential business closures, the gaming closures, and the impacts to our first responders and our healthcare workers. At the start of this emergency, we immediately began our Battleborn Kids Emergency Childcare. This started as a 24/7 childcare service to assist those first responders and healthcare workers. It is now sort of phased into a transition to a larger scale childcare. We've had, while we have capacity for about over 400 children each day, it's kind of a transitional program as needed. We've had over 10,600 unique applicants into that program, so we consider that program very successful. It's a program we provide at our rec centers, and with the distance learning that's being provided at the Clark County School District, we are providing those children with the technology they need if they need to do their schoolwork within that facility. And so I think, again, a common refrain we're hearing are the partnerships we have with other organizations. So I feel like we've worked very well and closely with the Clark County School District regarding their needs and how we can support them, how we can support families who have children within the Clark County School District. And so we're very grateful to have those relationships with these other jurisdictions. And we're trying to assist as much as possible for our community. In addition to that, another one of the largest amount of dollars spent is in terms of infrastructure. Of course, City Hall, our parks, our rec centers have all been retrofitted to allow for all the public safety measures that have been put into place, including social distancing, providing for hand sanitizer, and any other personal protective equipment that's required. We've worked very hard to provide modifications to our parks and our public areas to allow for those things. In addition, much of the money was spent on telecommuting and telework modifications made at the city to allow for telework, not just for city employees, but also to provide as much technology as we can to our citizens so they can, we can provide service to them in a remote manner as much as possible. So they can get done what they need to get done without having to come into City Hall. And whether that's, through electronic permitting or allowing for WebEx at our open meetings, we've worked very hard to provide those things so we can continue to provide the same premium level of service we feel the city of Henderson provides. Next slide, please. So in addition to that, we have these other 3 categories. Our staff time, of course, is one of the largest buckets of dollars that we've spent and are obligated to spend. This includes substantially dedicated staff time to responding to COVID-19. I can tell you in terms of just recently having cooling stations, providing food delivery, we've had some of our officers assist in many of those activities, not to mention just to the regular duties that they have on a regular basis. Some mandated leave and quarantine dollars as well are incorporated in those funds. Following that, we have public health activities. As the governor implements his directives, it's our job as a city and part of the working with the county as well, coordinating with them and enforcing and providing guidance to our businesses and our residents regarding any changes made to the directives on a regular basis. And so we have some dollars allocated there as well in terms of providing materials out to our residents and businesses to help them in terms of understanding the latest public health orders from the state. And then I think very important here, our business and community support. We recognize the hardship much of our businesses have gone through. And so we have our own program here within the city regarding business recovery grants or hardship grants. This started as a small program and was really focused on small businesses, so 20 employees or less. It was so successful, we expanded it to 50 and now 100 employees or fewer to help our business. And I think they've been very grateful in terms of the hardship they face, but how the city is helping them as well. We continue to work with our business compliance office in terms of statewide mandates and in our own unique recovery plan as a city. Next slide, please. And finally, we have our testing and medical support, so $1.7 million here. This is, of course, I think you're going to hear throughout a lot of these presentations, the personal protective equipment that's required for first responders, and also assisting our businesses in providing whatever health services they may need or PPE that they might need as well. And this is also support for our vulnerable populations here as a city. We have had some testing programs for city residents and staff. We had a unique Henderson testing location. We have contact tracing for our city employees. And we are already beginning our preparations or logistics for a potential vaccine rollout should that occur. So we'd like to be ready as soon as possible to assist our city in terms of the vaccination should that be deployed. In addition to that, we have supports to individuals and vulnerable populations. And while this may seem like the smallest bucket of dollars, we are very grateful to the state and the county who have stood up some very large regional programs. In the conversations as we were awarded these funds, the state and the county were much better positioned to provide some of these regional supports, including housing and homeless assistance. And so what we've done is spend our money in terms of trying to communicate to our vulnerable populations what assistance is available to them. We do have some programs, our resident recovery program, that's I think important for our residents in terms of assisting them. But where the county and the state were providing programs, we tried to, we directed our dollars in other places in order to help support those programs. And this way we could use ours for some of these other programs here, including food distribution. We also have a unique transportation program for our residents and some homeless sheltering and rental assistance. Next slide, please. So I'd just like to finish that with, complete this with just some of the opportunities and challenges. Again, I believe you're going to hear some commonalities throughout all of these presentations. We certainly support whatever regional, if there's a regional request for additional assistance from the state, we would just like to know that the city of Henderson understands its role here in terms of what assistance we need to provide to the city. We're very grateful to the county for the relief funds that we have been provided, and however we can assist. So our guiding principle has been to try to push dollars out as much as possible within the confines of the rules of the coronavirus relief funds as set by the Treasury Department and following the guidance, but to the unique needs of our citizens. But however, we have an additional role in communicating with the county and coordinating with the county. And however we can assist going forward, we are open to queries, concerns, questions. We're here to support. We just want to make sure that this committee is aware of that. If there were additional needs for support, we're ready and willing to help. We are looking forward to, there's possibility of future stimulus dollars. Hopefully might be included in there would be extension of the current dollars. The time frame has been very challenging. I think you're going to hear this over and over again in terms of trying to get these large programs. Just the infrastructure needed for some of these large programs can take time. And so it would be nice to see the extension of these dollars and hope for some future stimulus dollars. And again, an opportunity. We are optimistic that hopefully there will be some sort of vaccination deployment here in the future. We understand that this is a public health crisis that has created a fiscal and an economic crisis for our residents and our businesses. And that crisis crisis is not going away until there's some sort of vaccine or therapeutic to deal with this pandemic. And so until we can resolve that public health issue, we are going to continue to struggle. But we are already working on how we might go about deploying that. Some of the challenges, I've already talked to the expiration of the CRF dollars in December. It's a huge challenge for us. We are about 30% obligated or expense. I would like to leave you with some confidence that we are very confident that we will be able to get all of our money spent, 100% of it. If not, in our award, we are required to remit those funds back to Clark County if they have the ability to spend those dollars further, but of course, those dollars would go to the state. I know there are concerns all around though about our ability, if we had to return dollars of the county and even the state getting their dollars spent as well. We would like to see that money stay here locally in Henderson as much as possible, or the county, or within Nevada. So it is certainly a challenge. We are worried about the fiscal cliff for these community programs. We've stood up a lot of programs, including childcare, food distribution, and additional assistance for our vulnerable populations. Our concern is these dollars expire, then those services will have to be transitioned and somehow either eliminated or provided through our general funds. And so we're concerned about the fiscal cliff that's getting created here related to coronavirus relief funds. And finally, I just want to mention this, the long-term economic and social damage, the longer this crisis continues, we are closely watching and monitoring several metrics within the city of Henderson, including economic and social metrics, whether that's the unemployment rate, residential defaults, and just very concerned about the long-term economic and social damage, even once there is some solution to this public health crisis, that we will be in a recovery mode for quite some time. These are just three here, also on the right. Recent articles regarding issues looming here in Southern Nevada and across Nevada. And we feel like these are areas where we really wanted to focus a lot of our dollars because this is what we were hearing. And so we felt our focus was education, trying to get internet access to kids and support to the Clark County School District. And we certainly understand that there's these imminent shutoffs that are looming in terms of utility getting shut off for our residents. And so we understand that these programs are helpful, and this is how we like to direct our dollars. And so looking forward, we just wanted to leave you with that. Hopefully, if you have any questions, you certainly take them now or whenever you feel, if you want to wait until the end of the presentation. And with that, I believe I'm turning it over to North Las Vegas for their portion of the presentation.
Thank you, Henderson. Chairman Frierson and members of the committee, can you hear me?
We can.
Perfect, thank you. Appreciate the opportunity to present what we've done in North Las Vegas with our portion of the CARES dollars. I am joined here by my colleague, Director of Finance, Will Hardy. He will be taking a portion of these slides. I'd like to start and just frame where we are at and open it up to Director Hardy to explain the programs that we've used, the money that's been allocated, and the successes that we've had in those programs. As you know, North Las Vegas is a unique city in the, when you look at Southern Nevada. 252,000 residents. It is the largest minority-majority city in the state of Nevada. We've gone through our ups and downs through this coronavirus pandemic, experiencing a valley-wide unemployment rate of 15.5%. Next slide, please. As you can see here, this slide was shared, or a similar slide was shared by Clark County. The impact or disproportionate effect to Southern Nevada, especially North Las Vegas, is great. Our residents here in North Las Vegas have dealt with unemployment, business failure, and record number of risk for foreclosure or eviction as we go through this pandemic. Next slide, please. This slide offers a timeline as we try and go through this in a succinct fashion and not waste time as repeating what Henderson and Clark County have already said before us. When the CARES dollars were originally announced in mid-April and dispersed, most other other states received their dollars. And they started implementing programs. In June 29th, our governor announced funding plan that it would exclude many cities in Southern Nevada. Southern Nevada being the epicenter of this coronavirus pandemic, we experienced over 80% of the coronavirus cases statewide. Word of the CRF funding relief came as a huge breath of fresh air, and we assumed that the change for Nevada would happen in the sense that maybe Southern Nevada would get more money than Northern Nevada, because those dollars were expended and intended to help those that were dealing with the brunt of the coronavirus, and the money would be dispersed directly to those folks that were hardest hit, and the money would go directly to residents. The funds that we've received to date, as you can see there, August 3rd, we received a sub-grant from Clark County, add up to be about $23.8 million. When you do the math, we should have received, based on the Treasury guidelines, an allocation of $47.6 million. As it stands right now, the per person allocation that we've received in the city of North Las Vegas was around $93.15, as opposed to cities under 500,000 in Northern Nevada that received $184 per person. While both North Las Vegas and Henderson and other cities in Southern Nevada and cities in Northern Nevada, we all benefit from county services, the per person allocation obviously puts us at a disadvantage.
Can I ask that whoever's speaking, North Las Vegas in particular, stay close to the mic? It's fading in and out. I don't know if it's a noise cancellation issue, but we're having a difficult time hearing consistently.
I apologize. We've had some IT technicalities all morning long. Can you hear me better now, speaker?
That is better. Thank you.
Can you hear me now?
Yes, that is better. Thank you.
Okay. I'm going to turn the time over to Director William Hardy to discuss the next few slides.
Chairman and committee, we just wanted to point out that we're very grateful for the allocation that we did receive. And once we finally did receive an allocation, our governing body determined that the best way to spend this money would be to support the residents and our citizens of North Las Vegas. And that is why we decided that 83% of the allocation was earmarked for programs that would directly assist in the community. Next slide, please. As you can see, this is a breakdown of our allocation of $23.8 million. And as you can see, like other jurisdictions, we have direct emergency response costs, such as medical expenses, PPE, testing, and such. However, we've decided that the best way to use our funds would be the economic support for our community. These programs include small business assistance, rent and mortgage assistance, and others that would directly help those struggling businesses and residents in Southern Nevada. Next slide, please. On this slide, we wanted to highlight one of our successes. We believe we've done well with the Small Business Assistance Program. We're very pleased with how it's gone so far. A couple of the highlights: 48% of the grants have gone to minority-owned businesses. 38% have gone to women-owned businesses. And therefore, 25% of the grants have gone to businesses that were both minority and women-owned. In the short amount of time that we've had funding, we've been able to put together a program that allows us to send checks out daily to distressed applicants in Southern Nevada. We've received a lot of positive feedback, and there's a quote there from one of our recipients. We're very pleased with how that program is going so far. Next slide, please. On this slide, we wanted to highlight our intention to expand our small business assistance program and go for a second round. and allocated an additional $4 million to this program. In addition, we're putting a lot of effort into our rent and mortgage assistance programs that just started off this week. Jared will give you more details about that in just a minute. In addition, we have put together a Southern Nevada Urban Micro Academy and other programs that are assisting with education and other needs in our community. In short, we believe that North Las Vegas and Southern Nevada has been drastically impacted by this pandemic. And we believe the funds that we've been given are being used in the best way. And with that, I'd like to turn the time back over to Jared Luke.
Next slide, please. Thank you. Apologize for the technical issues we had in the beginning of this. I wanted to just highlight, in the short amount of time that we've received CARES dollars and we've had them available, which is 6 or 7 weeks, we've put out programs that have helped over 170 businesses. We put SNUMA together, which has helped connect children to their education. And I'd like to, this second XX residence, this program that we put together recently that was mentioned, CHAT. Part of this presentation was to help identify what we've done with the CARES dollars, what we're currently using them for. Will we be able to use them? And what are the outcomes of these programs? This program, it doesn't have a number by it because this program was released after these presentations were submitted to LTV. And the current numbers that we've gotten in applications for this CHAP program, which is a CARES housing assistance program, dovetailing in with what the county is, with what Clark County is working on right now and assisting those that are facing evictions, rent and arrears. And we're averaging an application every 9 minutes. I think that highlights the need. And I think it also highlights the fact that, yes, we will be able to spend not only the money that we have, but if there's any other funds that can be identified statewide that maybe have been allocated or set aside for a program that may not come to fruition before this sunsets at the end of December, or that another municipality or wherever in what we've already put money towards as a state can be utilized, and Southern Nevada residents. We have disproportionate effect, and we're helping folks as fast as we can. As been stated already, the need is only going to increase. And to Justice Hardisty's point earlier, where he discussed the confluence that we are kind of monitoring and watching come January of 2021, we don't have to wait until January 2021 to help folks catch up on their rent. We don't have to wait until they are evicted to then address the problem. We have an opportunity now, albeit time is of the essence. And if there was ever a question whether or not we'd be able to spend the allocations that we have received, all you need to do is look at NACO's report earlier and see that the counties and cities in the north have already attested that they will be able to spend the allocations that they've received, which by simple math is 2 times what we have received when you compare $93.15 per person allocation to $184 per person allocation. So we will obviously be able to spend the money that we've received, but the need is greater than that. Southern Nevada is 80% of COVID cases. It's 80% of the residents of the state of Nevada. We've carried the brunt of the COVID pandemic in COVID testing, positive tests, as well as deaths. You've asked for outcomes, and I think the best way to sum this up, instead of reading you something that has to do with dollar amounts, is to read this quote or an email that was received by a homeowner, I should say a renter, that had got an application in and was approved through our chat program, this program that was released. Her email came into one of our NLV Cares chat processors, and it says this: "I don't think you will ever understand how grateful I am for you and the program for the assistance. I am a single mom of 3 and was on the verge of being evicted due to this pandemic. I was offered a position with a large employer in Southern Nevada, and due to the COVID, the offer was rescinded. I then applied for PUA and was denied. And currently, I'm in the process of appealing, which means I've been with no income to pay my rent. This morning, 10/8, I was awarded with the rental assistance, and I couldn't do nothing but cry and call you to tell how grateful and thankful I was for your assistance. You guys have saved my children and I from eviction, and now in the process of assisting me with my bills, I am truly thankful. Man, I can say this a million times. Most definitely, a lot of weight lifted off of my shoulders." Chairman Frierson and members of the committee, I'm going to dispense with going back and trying to discuss the previous slides when we were having some technical issues, but in the advent of moving forward, if North Las Vegas, if the Southern Nevada region were somehow to come across additional CARES dollars governed by the state, I don't think that based on that email there and what we've done already in the short time, that we can continue to help residents, but we need to look quickly, we need to act quickly. We need as much support as we can from this committee and from our partners in Southern Nevada and from the governor's office to help as many folks as we can. Again, thank you to this committee. Thank you to our partners in Southern Nevada, especially to Commission Chair Marilyn Kirkpatrick for her leadership during all of this. And we will be available for any questions. I'll pass the time and the rest of the presentation to, I believe, Boulder City.
I'm sorry, I want to ask you, I don't think that we could hear a significant part of that, the last portion of what you were saying, and it sounded important. So I think you were lamenting what might happen if you're unable to continue to support residents, but we just lost that whole last part. If you could kind of go over that again, I think it'd be helpful.
I'm going to try and, thank you, Chairman. I'm going to try and figure out where we cut off. I was basically making the point that if Southern Nevada cities under 500,000, our allocation per person allocation amounts to $93.15 per person, albeit benefiting from county services. When you compare it to monies that say Reno or some of the other cities under 500,000 in the north received, it's $184 per person, albeit they are also benefiting from county services. The funding discrepancy or chasm is massive. Southern Nevada has dealt with 80%, if not more, of the COVID cases, deaths, infections, positives, testings, the whole 9 yards. We've dealt with the brunt. I know that we can make the argument of what the congressional intent of the CARES program was, but it's spelled out very clearly that it's to aid residents and folks that were directly affected by the coronavirus pandemic. However, what we have done in the last 6 to 8 weeks as a region, I believe is remarkable. We've stood up programs. We've pivoted. We've been nimble. We've worked as hard as we can under the leadership of Marilyn Kirkpatrick and the county as a region. And we've put these programs together. Were you able to, Chairman, were you able to hear the email response from the young lady that was approved for rent assistance?
I believe we were able to hear that.
All right. If there is any way that additional monies can be allocated, and I understand what the state's using money for, unemployment is beneficial. But if you can look at the number that, we have put out over the last 6 to 7, 8 weeks, I can only imagine and extrapolate that math out to if we had received funds when, crying out loud, when everybody else in the state received their funds, let alone when most other states received their CARES funding, and those states immediately deployed funds to their local governments. How many other folks would we have been able to help? And I guess that's really what I'm trying to, it's, while our numbers may not be as great as some of the others, look at the timeline and what we've been able to do. An application every 9 minutes, and I don't think people are sending in applications in their sleep. So that's a huge deal. And I wanted to thank the chairman, thank you, and thank the committee, thank Clark County for their support and leadership. And if there's any questions, we'll be available when these presentations are through, and I'll pass this baton on to Boulder City.
Thank you, Jared. Good morning, Chairman Frierson and the committee. I'd like to thank you for your time today. Your commitment to this issue has been incredible so far, and I think I hate to say, I don't think we're even midway through this. Boulder City is a community of about 16,000 residents. The average age is about 52 years old. As of this morning, there are 190 COVID cases according to the Southern Nevada Health Department. That's about 1.12% of our population. We are averaging about 140 tests per week. City Council of Boulder City has been extremely concerned about funding and making sure that our residents are taken care of during this critical time, especially because of our older population. The City Council asked staff to review and approve Resolution 7154 on September 8th, 2020. This resolution addressed the recommended uses of the grant award from Clark County, and may I say thank you to Clark County for the grant. This came out to a total of a little over $1.5 million for coronavirus relief funds. I'm going to go on to the next slide here. Over $1.2 million of that was for public safety payroll. We did find that we did have to utilize our public safety quite a bit, especially for the testing pods that were set up in our community, making sure that our senior homes had the proper PPE and making sure our first responders themselves had the proper PPE for dealing with this pandemic. This is an approved expense of CARES Act funding in line with other cities nationwide. $200,000 has been set aside for small business recovery grants and administrative costs. Starting within the next few days, Boulder City businesses will be able to apply for loans of $5,000 or $10,000, depending on the number of full-time employees. These grants will help pay for working capital such as rent, utilities, and COVID-related expenses such as cleaning supplies or retrofitting for employee and customer protection, which is critical to us all. We are also, in the next slide, we'll take a look here, we have $150,000 earmarked for all-day parks and recreation childcare programs. And we've also set aside $20,000 for communications compliance. Next week, upgrades in our communications equipment will help enhance our ability to carry live streams of our meetings to the general public, which, as you know, our general public is very politically active, and many people have expressed concern about coming to the meetings. Even though there are 15 available seats, we do worry about the proximity and the amount of time that people are in that area together. Finally, we've set aside $20,000 for food purchases for the Senior Center of Boulder City. The Senior Center of Boulder City provides lunches for residents. It houses a food pantry, and it is the service site for our Meals on Wheels program. Up to $50,000 is set aside for rent and mortgage assistance and utility assistance, which is to be administered through Emergency Aid of Boulder City. We continue to stay in contact with both of these agencies to make sure that our most vulnerable residents are getting the assistance that they need. Finally, let's take a look at how we are moving forward. In the next few days, few weeks, we will continue our communications with our senior organizations, homes, and residents. We want to make sure that we are fulfilling their needs as best as we can. We are also looking to maintain weekly free testing. We currently offer free testing every Tuesday from 8 a.m. to 10 a.m. And we continuously get phone calls during the week of people who are concerned about any potential exposures. So we try our best in certain situations to make sure that, for example, our first responders are getting the testing that they need on a regular basis. And finally, we are working with agencies on rent, food, and utilities assistance. We want to make sure that those agencies are getting what they need. Our utilities department, as you might know, our utilities are done through the city, our electric and we team with a company for trash removal. We want to make sure that if anybody cannot pay their bills, that we are working with them to make sure that their bills are taken care of, that their utilities are not shut off. We've avoided shutoffs for probably about 150 residents so far. And we've also had some residents who've actually put out their own money to make sure that their neighbors' utilities are not shut off. As you know, Boulder City is a community that is very close, tight-knit, and we do take care of each other. But in a situation like this, it really becomes incumbent upon our elected officials to help us where they can. Clark County's assistance in their programs has been extremely helpful. We do need that continued help, though. Our concern is how we continue to move forward, especially in light of the data that shows so many people may become homeless in the coming months. We want to make sure that we're staying on top of all of this, but also cooperating with our local agencies and doing what we can to make sure that they're protected. With that, I thank you for your time. And if you do not have any questions, I will be passing it on to Ms. Skeet.
Good morning. My name is Aaron Baker. I'm the City of Mesquite. I'm the city manager. I appreciate this opportunity to address you about the city's use of CARES Act funding. I'll try to be brief and not cover everything that everyone else has covered. I do want to say from the beginning, we are highly confident in our ability to expend the funds. We do have a plan in place and we are working that plan. So next slide, please. A quick overview of Mesquite. You can see that there. I will say two things of interest. One is as Clark County started to experience an uptick in cases, it was a little bit slower for us just because of our geographic separation from the Las Vegas Valley. So that lagged a little bit. We do provide in Mesquite kind of the regional hub for Northeast Clark County for medical services. We have been grateful for the regional efforts by Clark County and others for the expertise and support that otherwise would be unavailable to us because we are a smaller organization. As well, we have a coordinating council that meets. It's of nonprofits and faith-based groups in the community. We work together to try to support everyone in need and maximize the resources that are out there. So with that, I'm going to go through a little bit about our allocation and how we are working with that. So thank you. You have a table here that shows the purposes. One other note that I want to make, I won't read you the table, you can see it. For FY 19 and 20, Q4 and FY 2021, those are actual expenses. It doesn't include encumbrances. Consequently, you're going to see that some of the data is skewed. Stuff is in process, but we just haven't actually been able to book it yet. So next slide, please. As medical expenses, we have COVID-19 testing. The city of Mesquite does all of that testing for our community. SNHD processes the tests. They also provide the tests, and they've been a fantastic partner with us in that. But the effort to test the community has been led by the city. And you'll see that those numbers look maybe a little low, and that's because those staffing costs are included in payroll expenses I'll talk about later. These costs are basically costs that are incidental to testing itself. So next slide, please. And these public health expenses, this is PPE for public safety and for other city staff. So next slide, please. Public health compliance. Excuse me, wait. Apologize, maybe I'm off on my slides. Oh, no, I apologize. I got my slides out of order. This is for these public health compliance measures. Some of the things I really want to highlight here is that we've been able to make some steps that really help ensure the safety of the community, like electronic plan review, better technology for public meetings that allows for greater public participation. We've had kind of the traditional format, and we've been able to do some things that allow greater participation. Live commenting during city council meetings, for example, and that's been very helpful. We've actually had more people participate than ever before because of those technological advances. You will notice there are a lot of expenses that look like they're in Q2 of this fiscal year. A lot of those costs have been encumbered. They've not actually been booked yet, just because we haven't received those things or the project hasn't finished yet. So next slide, please. Oh, I think we missed a slide. If I could back up 2 slides. I think payroll expenses we missed. One more, please. Back. Sorry, Joanna.
I'm sorry, Erin. I'm trying to get back. I was able to get back to public health compliance. Hold on.
If it doesn't work, it doesn't work, and it's fine. I can just give an oral report.
Yeah.
On the payroll expenses, what we did as an organization is we tracked them by the hour on timesheets. We
I don't see it in the slide.
to COVID 100%, tracked by the hour. That includes EOC staff, public safety, community testing efforts to comply with the directives, and staff assigned to COVID-related tasks there. So then on economic support, we are working with local nonprofits and other organizations to help get these funds out to assist for housing and utilities, and also for small businesses for rent, utilities, PPE, and retrofitting their facilities in order to comply with the directives that are in place. We're really excited about these programs and their ability to help local businesses and residents. So, and then finally, last slide, please. Other expenses we have encountered, we didn't anticipate any, but then we realized we have had some questions related to compliance with CARES guidelines. So we've worked with our auditor, we've incurred some expenses there. And so that's what these other expenses would be for us. So that is my presentation. With that, I'll pass it back to Clark County.
Thank you, everybody. And I know this has been a long presentation. We wanted to do it this way because we really have been working together, Clark County and our municipal partners, on trying to maximize the support that we are able to get out into our community because of the CARES Act assistance. I just wanted to really renew, and I think you heard this from the municipal partners, and you certainly heard our public comment at the last meeting, that we really are concerned about the fiscal cliff that is coming with the end of these dollars, and with the need that we see for our constituents and for yours as well. I know that we share that concern with this committee, so I've just kind of updated what we looked at when we were looking at a regional need and how we believe that this is how we could use, if there is additional funding that we can have for Southern Nevada, this is how we could deploy it. As Mr. Schiller had noted, we are deploying extra resources and doing everything we can to get the need or to meet the needs of our community and to get assistance to where it is needed. But at current funding levels, we believe we can only cover the needs for 14,000 households. We are unified, I think you heard that today, in its support. And we believe our biggest need is in housing and to preserve housing stability for our constituents. We had testified to this at the last meeting. We have estimated that we could need as high as $159 million to just meet half the need that's being forecasted. That's a staggering number. And we know that that's not something that would be easily found, but we're asking for your consideration as you continue to do the work that you do. For potentially looking if there's some additional direct assistance that may be deployed through the partnership that you've heard today for Southern Nevada residents. So that concludes our portion of the presentation. Speaker Frierson, and I can stop sharing my screen at this time.
And for the record, that was Joanna Jacobs. I've been talking without realizing I was muted when I was trying to clarify who was speaking. So I apologize for that, but I want to make sure folks.
My apologies. Yes, that was Joanna Jacob, Government Affairs Manager, Clark County. Thank you.
Thank you. I know that I do have at least a few members with questions. I think Assemblywoman Howdy.
Thank you, Mr. Speaker. And I think a lot of my question was answered in the following presentations, but if we could go back to the initial Clark County presentation where they were talking about their CARES Housing Assistant Program. It was just a quick question for Ms. Jacobs. If you could let me know, I know you had mentioned, I believe the number was 45,000 assistance applications that you had received, and to date, there was about 2,700 constituents who had been served. And you were estimating about 14,000 families who would be able to receive assistance. So how are you prioritizing those? Is it just a first come, first serve basis? And with the remaining applications that were received that aren't going to be eligible for assistance because there's no more money, are you going to be referring them out to the cities in which they live in for assistance?
So this is Kevin Schiller, Assistant County Manager for the record. To answer that question, yes, that's correct. We had seen an initial about 45,000 inquiries. Specific to the application process and specific to how it's served, that was done on a first come, first serve. That's how those are being allocated. But with the addition of the professional staffing agency, which is also actually doing contracting for LA County for their adjudication process. They will continue to do those that are in the queue to finalize those. And I think I mentioned this earlier, we have that additional 20 million that is going with our 30 million. We will look at if we run out of funding for those 14,000, what we will, or towards those 14,000 or above that need, we also will be looking at where any other funds are allocated. And I did want to emphasize post-CARES, we are also looking in our social services funding how we are going to continue some level of rental assistance and prioritization with existing funds. Obviously, there's huge deficits with the economic impacts the county and our region is facing. But whether it's the transitional housing I spoke to or whether it's rental assistance, we do believe it's obviously much more costly if somebody is evicted or cannot pay their rent. So we're trying to figure out how we prioritize that diversion post-December. But we are expending those dollars as if we will not get any other assistance in January and looking at mitigation plans moving forward.
Yeah, and for the record, Joanna Jacob, Government Affairs Manager, Clark County. I'll just add, in response to your question, Assemblywoman, with regard to the other city programs, a lot of what we do, this program is deployed through our nonprofit partners. So, for example, and I don't want to speak to the city of Henderson, can certainly speak to this, but they have deployed some of their funding to help the nonprofit who is helping the residents of their city. So our social services division is having regular calls with our nonprofit partners, and they themselves are collaborating on how to deploy these resources quickly. And we are trying to find efficiencies where we can to maximize the assistance.
Thank you, Mr. Speaker, or Chair.
Thank you. Any other questions? I know some people indicated they had some at some point, but I think got them answered in the course of the presentations. I'm going to ask the question that I've asked everyone, and I'm going to ask for the rest of this meeting anyway, about the level of confidence that the amount of money that's been allocated will be spent and what the plan is for local governments. Or I guess now Clark County and those within Clark County, if we start approaching the end of the year and there's money that has not been allocated. And actually, I remember I saw a slide at the beginning that discussed an amount that was obligated. And I wanted to just get clarification on what portion of that has actually been spent and what portion is still planned on being spent by the end of the year.
Hi, good morning, Chair. This is Yolanda King, Clark County County Manager.
We are very confident that the dollars that have been allocated to Clark County will be spent before the December deadline. We anticipate that with the rollout of, I'll call it round 2 of the housing assistance program, which was to begin next week, that a bulk of those remaining dollars will be spent for that program. In addition to that, we have just closed our business recovery, our round 2 of our business recovery program. Last I heard, we had received about 1,400 applications for that program. So I do anticipate that the remaining dollars on the business recovery side will definitely be spent, before probably end of October or first part of November. So we have definitely a number of programs that are in the process, have rolled out, will be rolled out. And as we've stated on the call today, that there is a very significant need on the housing side. And just as we experienced in round 1 of the housing assistance program, where we received tens and thousands of requests, we anticipate that once we open this back up next week, that it will definitely kind of roll through those dollars very, very quickly. Jessica, in terms of the actual dollars that have been spent, of what's been obligated and spent?
For the record, Jessica Colvin. I don't have that. I can follow up with you with that exact dollar amount, but the obligations, it's not just an allocation. It's where we have a contractual obligation to spend that, for those services to be provided to the county through December 30th and for the county to pay for those services. So an obligated amount to us equates to what will be spent by December 30th.
And I would attest, and we can get that exact percentage for you, but Speaker Frierson, I would attest that most of that money that we reported having been spent or obligated, most of that money has actually been spent. It's been dollars that have gone out the door. As Jessica indicated, we have contracts that are in place that have obligated, or we will be obligated to spend those dollars. The obligation dollars are just the same as being spent, where we have to expend those dollars by the end of December. So we definitely will make sure, we are committing, and we know that we are going to spend all of the monies that have been allocated to us.
Thank you. And for that was Yolanda King. Ms. King, could you, and I realize that Clark County in particular, and I think North Las Vegas reiterated the work that you all have done to really come up with some ways to support the community that is laudable. In the off chance, for whatever reason, that we approach the end of the year and some of those contracts don't come to fruition or something falls off, is there a plan for an alternate use?
Chair Frierson, this is Yolanda King with Clark County for the record. The alternate use, it will be for rental housing assistance. And so as we roll out our next phase of the rental housing assistance next week, in my opinion, it's still early on, where we will know if all those dollars will be spent before the end of October, beginning of November. We'll open it back up, or we'll continue to process those applications on an as-needed basis. We are confident, and we know that we are going to receive more requests than what we have funding for. And so with that ability, with the requests coming in as we anticipate they will come in, we'll just continue to process assistance for housing, based on the amount of funding that we have available.
And Speaker Kevin Schiller, Assistant County Manager, I wanted to add just to echo Ms. King's comments, two pieces that I think are critical related to those expenditures. You heard about mediation earlier on the other agenda item. We have been active in those conversations. We expedited a contract with Legal Aid of Southern Nevada with our rental assistance program pre the Supreme Court. But I also wanted to echo the fact that we are working on corporate mediation with our major landlords, where we have in multiples of hundreds upon hundreds of tenants towards processing in our new attestation process. So we have those lists. And so when we say we're confident we're going to extend those dollars, that's part of what we're projecting based on the numbers that we're currently processing. So we aren't just doing individual applications, we are also doing major complexes with, upwards of 200 to 300 tenants. So that's the other piece that I think gives us that confidence that I wanted to make sure I emphasize.
Thank you. I appreciate that. That shows, I think, a clear vision long-term, at least for the remainder of the year, to make sure that we have some options in the event that we need them. I really appreciate that. Do I have questions from members? I'll look in the chat. Okay, I don't see any other questions. Thank you all for that presentation. I mean, obviously, a large part of the purpose of this committee or subcommittee is that the public doesn't always have this information at their fingertips. And so this gives us an opportunity to make sure that the public is aware of all the hard work that's being done to try to meet the needs of the community. So I appreciate what you've done, but also your availability to talk about it. Are we done? Oh, I see we're going to do City of Las Vegas separately. So next up then I have Washoe County.
Hey, good morning. Can you hear me?
I can.
All right. Let me see if I can share my screen. Okay, can you see that?
I don't believe we can see the screen.
Mr. Chair, this is broadcast. Permission to assist?
Please do. Thank you.
Thank you, sir. Mr. Brown, at the bottom of your screen is a green share screen option. If you choose that, another window will pop up and you may choose your presentation in there.
How about that?
I can see it, sir. Go ahead and make it full screen.
All right, and then one more click and we should be there. How about that?
Fantastic. Thank you, sir.
Thank you for the assistance. All right, so good morning, Mr. Speaker. For the record, my name is Eric Brown. I am the Washoe County Manager. And this morning I will be sharing our overview for CARES Act funding and how we spent the money and how we plan to spend the money going forward. I would echo the comments of Ms. Stapleton and my colleagues in Southern Nevada. The county is working closely with the city of Sparks and the city of Reno to address ongoing mitigation and recovery efforts with regards to the COVID-19 pandemic. And we're confident that we will need every penny of what's been afforded us, and our intent on making sure that those expenditures happen in a timely fashion. I'll go to the first slide and just point out our situation is a little different in Northern Nevada than what you heard about in Clark County. Each of the municipalities did receive an allocation of CARES Act funding from the state. Reno received $46.6 million, the county at $20.2 million, and the city of Sparks at $19.1 million. So as I go forward, I will be focusing on how the county is spending the 20.2. And please know that the three municipalities, three managers meet multiple times a week. We have been doing that since the pandemic started in mid-March to make sure that we're coordinating our efforts. To your question earlier about duplication, potential duplication of efforts, I can say that here in Northern Nevada, we spend a lot of time making sure that our efforts are complementary and not at cross purposes or duplicative. I should also say that the Washoe County Health District and the health officer also participates in those meetings, which occur three times a week at this point. If you look at our regional expenditures in the county, this is from the March through June period, so pre-CARES Act, if you will. We've spent about $7.8 million, and you can see how that breaks out. The county actually entered into an interlocal cost share agreement with the city of Reno and Sparks, in which the county agreed at the outset of the pandemic to pay 50% of the shared cost, city of Reno at 35% and city of Sparks at 15%. So that's why you see the arrangement shown there. I would also mention that we've submitted $9 million in shared expenses for FEMA reimbursement. We've been working closely with our FEMA partners and our partners at the state to make sure that the things that we're requesting for reimbursement are in line with the FEMA guidelines. But obviously, if for some reason those funds were not reimbursed by FEMA, we would have to find another way of funding those expenses. And to the extent we know that before the end of the year, CARES Act would be one of the ways that we might do that. Moving to the next slide, this sort of shows the major categories of expenditures year to date. And you can see that a large part of our expenses from the March through June period was for what we call the Edison compound. So we actually created surge capacity in trailers that would allow folks who had become infected and needed to quarantine or self-isolate for some period of time to do so. Thankfully, we were not tasked with using that facility, but that is the largest category of expense that we saw to begin. You can see the incident management team, which was formed immediately after the pandemic to help manage the response. The post, we actually stood up testing facility here on by the county complex on the 9th Street campus that still operates today. And then the alternative care site was a surge facility that would have provided up to 700 additional beds at our convention center. Again, thankfully, we didn't have to stand that up. So the expenses you see there were the expenses incurred to prep the site and do the initial preparations. But the trends were improved to this extent that we didn't need to do that. Okay, so our initial allocation of CARES Act funding was about 10.1 million, of obviously half of the 20.2. About 4.1 million of that was internal expenses to the county, and about 5.9 million of that was for regional expenses. Looking at the broad categories, the public health expenses were the biggest category. That included the quarantine facilities that I talked about earlier, PPE that we've been procuring on a regional basis for the 3 jurisdictions to serve our first responders, our medical personnel, our human services agency folks, and others who have a need for that, but also to make it available for the broader community as appropriate. the incident management team, homelessness expenses, and that, as we look at the balance of the year, will be one of the major categories that we'll have to address. I'll talk about that more in a minute. Public outreach, and then the 3 jurisdictions agreed to participate in a UNR wastewater study, which is underway. Under health compliance, just under $2 million there for things like food access and delivery. The county provides resources for our elderly folks, our senior centers, and so we were tasked with repurposing how we provided meals to those folks because of the pandemic and the requirements to do so. We set up telework capabilities for our employees, as well as expanding sanitation and social distancing in our detention center. Medical expenses, again, testing, contact tracing, and the alternative care site. Payroll, particularly for our public safety and human services personnel. And then we did, at the request of the Board of County Commissioners, we are participating in the NACO business assistance program that was mentioned earlier, to the tune of $500,000. In terms of the second allocation, and this is pending Board of County Commissioner approval, which will be reviewed and approved in the next couple of weeks. We are seeing a need for additional homeless services and support. So the county has been working diligently pre-COVID to set up the Our Place, we call it the Our Place campus, which is on the NAMS campus, just sort of east of the DMV building here. It did open here this fall, but at the time of its development and design, again, pre-COVID, we've now had to go back and make adjustments to provide for social distancing in accordance with the CDC and health district guidelines. In addition, we know that we're seeing an expansion in the number of people who are seeking homeless shelter. So as a result of that, over the balance of the year, again, we're working with the other jurisdictions to figure out how much of those resources, how much of those CARES Act resources will be required to meet that need between now and December 30th. City of Reno, similarly, is working to accommodate the men population that were initially housed in their Records Center, Record Street campus, which is no longer able to accommodate those folks because of social distancing requirements. And there's working diligently to try to set up, well, they have set up a temporary care site, a temporary site on 4th Street. And we continue to look for a permanent site solution for those folks. So part of our expenditures will definitely be directed towards those shelter and temporary expenses. In addition, we have human services payroll costs that are associated with the expanding impacts of the pandemic. $2.5 million, we think, for public health and safety. So these are personnel costs, contact tracing. Chair Lucy showed leadership in terms of offering to assist the Washoe County School District with their plans to reopen. So we are providing, the county is funding contact tracing nurses to help support the school district as they reopen in terms of mitigation efforts there. The quarantine facilities, I think a similar woman, Bowles, was asking about this earlier. We do have multiple facilities here in the county that are used for folks that need to quarantine, whether they're first responders or visitors or whatever the case may be. And then we are continuing to execute community safety campaign that is focused on our two drivers of COVID infection in our region. Those are our Latino populations, which have consistently been about half of the new cases that we see here in the region, as well as our young adults, in particular the 18 to 24-year-old age group, and our UNR students. And so our messaging is directed with a prioritization against those two groups. I will say that I want to applaud President Sandoval. The health officer and I met with him and his leadership team, and he has stepped up in terms of mitigation efforts. We've seen some of that in the media. I think there were additional announcements this morning that I think will be very helpful in helping to address the surge that we're seeing, especially in those young adult populations. The next category of 1.7 million is technology and telework support. So the county was already in the process of enabling many of our 2,700 employees to be able to work remotely, but our technology really wasn't set up to do it at the scale that we now know we need to. And so we're spending the dollars as appropriately to allow those positions that can work remotely and still be effective in terms of meeting the needs of our constituents and our businesses to do so. And that has been very well received by our employees. Our regional PPE supply, we are continuing to compile a strategic stockpile. And then last but not least, our justice and courts, which are beginning to return to jury trial, but they are also continuing to conduct hearings and other activities where we're using video conferencing technology as well. So those are the major categories. The other thing I would point out, Speaker Frierson, with regards to some of your questions earlier about duplications of services, because remember that when you see some of the items that are listed as being spent by municipalities in the March through, let's say, June or July period, in some cases, we found ourselves procuring things and spending money on mitigation efforts because the state had not yet set up some of the services that are available today. As the state began providing things like PPE or contact tracing assistance, other things of that nature, at least here in Northern Nevada, we've been working very closely with them to make sure that we avail ourselves of those resources, and so that we're not unnecessarily duplicating our efforts with what they're doing. And I would say it has gotten increasingly better as time has gone on. So the health office, the health district, the 3 municipalities in the state, to make sure that we're not duplicating efforts. So with that, I'll take any questions.
Thank you. I'll just briefly, before I lose track, you had mentioned that you were hoping or planning on submitting for reimbursement from FEMA, and if you didn't, that you could possibly be looking at CARES dollars for those reimbursements. Is that part of the existing allocation, or would that be an additional request?
That would be what we would have to do, Mr. Speaker, is we would have to reallocate our planned expenditures between now and the end of the year to accommodate that.
Thank you. Other questions? Okay. Seeing none, no other questions? Well, it certainly sounds like you have a plan. Again, I ask everybody at the end about the remote chances of not spending it by the end of the year, how confident are you in that? And then what, if in the unlikely event that there is some change and there's money left over, what is the contingency for using that money? The FEMA reimbursement is at least one.
Yeah. I'm sorry, Mr. Speaker, I can assure you, I spend a lot of time every week with our financial folks reviewing our weekly updates on spending. We have contingency plans in place so that if expenditures are not going to occur by the end of the year to comply with the CARES Act requirements, we're able to quickly reallocate those dollars and for other uses. There is more demand than the 20.2 million we've been allocated. So shame on us if we don't make those adjustments. I'm very confident that here in the North, we'll be able to use all those funds.
Thank you very much. Any other questions of committee members? All right, seeing none. I think that this is probably a natural time to take a break, finishing up with the counties. We still have City of Las Vegas, City of Reno, League of Cities, and a few other things on the agenda. I would then recommend that, I guess we can take a lunch break now, say 30 minutes. I'd rather just do 30 minutes and then get back to this to not keep everybody too late on a Friday, if that's okay. Okay, well, let's, then it is 12:06 by my watch. Let's get a clean 30 minutes at 12:36 or so. We'll start asking for everybody to light back up on their cameras and pick up where we left off. So we are going to be in recess for 30 minutes. I'll see you all in a little bit. About a minute out, if members could make their way to their computers and get the video back on, we can certainly pick up where we left off. Give it a few minutes again if folks get their cameras back on as they make their way back. So we have almost everyone back. I believe that Assemblywoman Benita Thompson had to notify me that she did have to step out, but no one else. Mr. Jones, if you can help me out here, I think we're only missing Assemblywoman Tolles now.
I'm here. I'm just still eating and I didn't want to make you watch.
You're wearing your glasses, I'm not, so I can't see anything right this second. All right, I think that we're good to go. We are live already?
Yes, Mr. Speaker, Mr. Chair.
Thank you. Thank you, Ms. Jones. We'll go to the next presentation in City of Las Vegas. I believe I saw Gary Ameling, but I'm not entirely sure who's going to kick off for the city.
Mr. Chairman, this is Scott Adams for the record, city manager with the City of Las Vegas. I'll be joined in my presentation by Gary Ameling, our Chief Financial Officer. I want to thank you and the members of the committee for giving the city the opportunity to allow us to present how we've responded to the pandemic and then further how we've prioritized and spent our CRF dollars. If I could get the next slide, Gary. So I want to jump right in. When our city council passed our declaration of an emergency, we really have followed three primary priorities as we've really worked through the pandemic. And all these are somewhat equally important. You really can't have one without the other. We really focused on the health and safety of our employees. We focused on the health and safety of the city's residents, businesses, and other stakeholders. And we really wanted to maintain essential operations. You really couldn't have any one of these without the others. They all intertwine and are mutually reinforcing. And I think you'll find as you see our presentation that these priorities find their way through every aspect of what we did as we worked our way through the pandemic. Next slide. So we undertook a number of major actions over the last 7 months, but in particular over the first couple months of the pandemic, really starting on March 17th, which is shortly after the state declared its emergency. Our city council declared their emergency. That emergency, under our charter, really gave the city manager a lot of authority. So I end up having to get ahead of the council quite a bit and act on a lot of these things very, very quickly to be sure that we were properly responding. We quickly formed an internal COVID-19 response team. We opened our emergency operations center for logistical support, and that center has been the one that's been working on PPE, coordinating with the MAC, the regional EOC, and other really purely emergency functions. We had to quickly identify which employees were essential and non-essential. And that really led to actually sending some of our non-essential employees home. A number of employees were furloughed. It was about 300 employees for the initial period of the pandemic until we started to see things reopen. We provided infectious disease leave initially and childcare support for employees. I think one of the things that was profound was over the weekend leading up to the emergency, right after the governor declared the emergency, was the closure of the Clark County School District. That really left, I think, not just us, but any employer somewhat in the lurch in figuring out how to deal with their employees that had school-age children. And then I think, as you saw in the county's presentation, we did work with Clark County to open our ISO-Q facility at Cashman to deal with our homeless population in terms of meeting their needs there as it relates to the COVID-19 pandemic. Next slide. I think one of the things, and a number of these issues really underscore the severe financial impact of what the pandemic's caused the city of Las Vegas. We implemented a hiring freeze. Actually, we started that hiring freeze pre-pandemic because we've been in a structural deficit for the last couple of years. Our wage and benefit growth rate has crept ahead of our revenue growth rate. And so we virtually froze every position that was vacant. We began our concession bargaining. We had been in the middle of concession bargaining, and we really went at it in earnest. We deferred payments and waived a lot of penalties for our residents and businesses on a really wide range of fees and services that really became due and payable during the period of the pandemic. We set up very quickly, literally within 48 hours, a new customer service and payment center. That payment center is now permanent in the base of the City Hall parking garage, kitty corner from our City Hall. This is one of the positive outgrowths of the pandemic, where a lot of creativity and innovation of our team created a function that now serves our customers better. All customer responses go through that center to better serve our customers in every aspect of the city's operation. We also created a multi-departmental grant team that looked at all the available federal and state grant programs available to the city. And, in addition to coronavirus relief funds, we had identified probably another $17 million of additional federal dollars, most of which we pushed out into the community. I know you asked specifically for coronavirus relief funding today, but I just wanted to make that point. And then another thing we've had to do, and it's been rather daunting for a city our size, is deal with the whole process of enforcing directives, because we've had a period initially where we shut down. We had to abide by and enforce all the directives dealing with the shutdowns and the closures related to the pandemic. And then we found ourselves in a situation in early June where we had to develop reopening plans and make sure that we could reopen our buildings, our facilities, our programs and services, and do so safely. And so there were a whole range of things that we did which were extraordinary, not things that you normally do as city government, that were clearly COVID-19 related, that we normally wouldn't do in a normal course of business operations. So I wanted to provide this early backdrop to kind of set the stage for the kinds of things we've been doing that were pandemic related. At this point, what I'd like to do is turn it over to Gary Ameling, who's going to take this one step further to talk about frame our budget problem and talk in more detail about how we spend our CRF dollars. Gary?
Thank you, Scott. Good afternoon, Chair Farson and members of the subcommittee. Thank you for having us today. I wanted to talk a little bit about some of the financial impacts to the city. Previously to the pandemic hitting, we actually had been having a pretty good fiscal year in fiscal year 2020. The first 7 months or so, we were running ahead of budget. Our estimate at that time was we were going to come in our general fund about $23 million over budget in terms of revenue collections, which we were pretty pleased about. And we'd already started our budget process for fiscal year 2021. After the pandemic hit, we quickly realized that those projections were out the window. And we worked with our regional partners on developing new sets of revenue estimates, which really tempered the outlook going forward. By the time we got to adopting our budget in the month of May, those estimates for fiscal year 2020 had turned from being $23 million over budget to being $55 million under budget. And our outlook for fiscal year 21 had been that we were going to remove about $124 million from our previous projections for a total of almost $200 million over just the course of about 15 months or so, the last 3 months of fiscal year 20 into the first 12 months of fiscal year 21. We also were projecting in our 5-year forecast that we were going to see continued degradation of our revenue sources, and it was going to probably take until latter part of fiscal year 22, perhaps even the fiscal year 23, before we got our revenue estimates back up to the levels that they had been previous to the pandemic. Obviously, our main fund is the city's general fund, and the major revenue source there, making up typically more than half of our general fund revenue, is our consolidated tax, which, as you know, is a state shared revenue. But also impacted were licenses and franchises, charges for services, and other revenues. And then the rest of this chart just goes through some of our other funds and some of the concerns we had and some of the revenue sources there, just highlighting a couple of those: parking and citation revenues, our car rental tax, which supports our Performing Arts Center, the Smith Center for the Performing Arts, motor vehicle fuel taxes, which support our transportation construction projects. Our parking garages are funded through a tourism improvement district sales tax. So that was important for us to keep an eye on. And then some of our building permit revenues, at least at the beginning of the pandemic, certainly took a drop compared to what they'd been at before. And then lastly, room tax revenues. This next slide talks about our allocation of the CARES Act monies. As you know, back on March 27th, the CARES Act was enacted and $150 billion appropriated to the Coronavirus Relief Fund, or CRF, for allocation to state and local governments. Nevada was allocated the minimum amount for each state, which was $1.25 billion. In accordance with the formula, 45% of the per capita amount was made available as a direct allocation to any cities or local government entities with a population of 500,000 or more. And for Nevada, that was City of Las Vegas and Clark County, who you heard from earlier. In the way the formula works, just to make sure everybody's clear, they actually subtracted our population from the population of Clark County before they gave Clark County their allocation. So they received the same per capita amount that the city did. We did file for our direct allocation on April 13th and received that direct allocation of $118.9 million on April 22nd. We've now done two sets of reports to the U.S. Treasury, and this slide shows you our expenditures to date through the period ending September 30th, 2020. And it's in the format that the U.S. Treasury required. So some of the categorization perhaps doesn't give you a lot of indication of what some of these expenditures are for. So I've got a couple of slides after this one, which we'll go through and talk not only about what those expenditures were for, but what some of the outcomes were with respect to them as well. So at the top, our $118.9 million allocation, and then subtracting from that, getting down to a balance remaining at the end of September of $2.8 million, indicating that we've now spent 97.6% of our allocation. And this is not amounts that are committed. These are amounts that are actually expended on this slide. So the primary area where we spent money was in supporting our public safety services, 104.9 million. Personnel that were diverted from their regular duties to a substantially different use, 4.3 million. Medical expenses, 0.4 million. Economic support, which we heretofore have spent 6.4 million. And then as you see in the footnote at the bottom, we have the remaining amounts of money that we have already committed, $2.1 million to Catholic Charities to construct an outdoor dining pavilion, which will help us safely serve meals to the homeless population. And then the remaining 0.7 million of an allocation that we put towards housing assistance, which I'll talk about on the following slide. And then the catch-all category in the U.S. Treasury categorization is all items not listed above. And I'll talk about that in just a moment as well. One thing we wanted to point out is that we spent a lot of time making sure that we had a good understanding of the initial guidelines and the frequently asked questions that have come out over the course of the last 6 or 7 months from U.S. Treasury and from the Office of Inspector General. And we believe that all of our expenditures have been made in accordance with those guidelines and frequently asked questions. As I mentioned earlier, our top item was payroll for public health and safety. The city has its own public safety department as well as its own fire and rescue department. And we were able to support those operations as well as our contribution to the Las Vegas Metropolitan Police Department during the early critical months of the pandemic, the last 3 months of fiscal year 2020. It also provided us the ability to limit our fiscal year 2021 reductions in those public safety departments. Because of the budget deficits that we had to tackle, we had to make reductions in virtually every city department. And those reductions were 20% across the board reductions. And because we were trying to make sure that we limited those reductions in terms of public safety, we restricted the reductions to 10% in our public safety departments. And then we also enabled us to avoid reductions in force. We had earmarked over 200 employee positions that would have been eliminated. But we were able to save those positions by using the coronavirus relief fund monies in this fashion, which, as earlier you heard, was one of our major objectives. Second category, budgeted personnel and services diverted to a substantially different use. Here we reallocated non-public safety staffing positions to address the critical pandemic needs. Examples of that were putting staffing towards homelessness efforts, staffing the isolation and quarantine facility, which you heard about earlier. We also operated a child care facility for city staff as well as for public safety staff throughout the valley. And then the last category under here, the administration and enforcement of COVID-19 related issues, including the shutdown, the reopening, and enforcement of all state directives. Next category, medical expenses. You saw $0.4 million. And again, as the city manager pointed out, this is in addition to other grant monies that we received. So it may sound kind of small at this point, but a lot of the other monies that we received from other grants went towards this category as well. We did purchase personal protective equipment. We provided some funding to support community testing. The economic support category, one of the largest categories for the city, we put money towards a financial assistance grants program for small businesses. We put that out in 2 tranches. Our initial $4,000 tranche was very popular. And so we put a second $2 million tranche in. I may have misspoke. $4 million was the first tranche. $2 million was the second tranche. And that went out in terms of small business assistance grants totaling $4,000 each. So we were able to put 1,500 of those businesses back into operation through this assistance. Our second category of economic support is our housing assistance program. And here we've used $1 million of the coronavirus relief fund monies coupled with about $3 million of our CDBG monies for a $4 million program. The average grant that's been going out has been in the neighborhood of $3,400. And we've been hopeful that we can put out more than 1,000 of these grants with this program. We have had about 1,700 applications. So like the small business grant program, unfortunately, we have not been able to fund every business and every person who needs housing assistance with this program. We also provided funding for what we called our Dine Out Downtown program. This was about a $100,000 program that basically allowed us to close city streets and provide restaurants and businesses that were located adjacent to those streets an outdoor dining area where people could come in and get takeout orders and sit down and eat them in a safe location. And then the last category that I mentioned, the catch-all from this federal government's categorization, is all items not listed above. And the primary expenditure here, about $100,000, went towards our Healthy Parks program, which basically added some technology to those parks that enabled us to make sure that people were using them safely. And that is the primary way that we have used our coronavirus relief fund monies, and City Manager Adams and I are happy to answer any questions that you may have.
Yeah, let me just say again that we thank you for the opportunity to speak, and hope we can answer any of the questions you might have.
Thank you. Committee members, I'm sorry. Do we have any questions of the committee?
Mr. Speaker, or Mr. Chair, Senator Goycochea.
Sorry, I was having a little bit of technical difficulty. Senator Goycochea.
Thank you, Mr. Chair. I just was kind of curious. Okay, you kind of lumped us into a catch-all category. Now, what are the provisions for an audit? Or let's say if the feds do in fact find something, think that is irregular, some of your expenditures, then is there a clawback or a payback provision, or is the state on the hook? I believe the state's on the hook. Is that not right?
Well, first of all, this is Scott Adams. We have spent a great deal of time, as Gary said at the outset, examining the regulations, engaging with the Treasury guidelines to be sure that the method that we've used and the strategy that we've deployed for expenditures is consistent with our guidelines. And we believe we're spot on. We don't believe there's any problem with it. In fact, I have outreach to some of my peer city managers around the U.S. and other major cities, as Gary has done with other finance officers. And there are numerous cities that have been using the same strategy. So we think it's one that's going to be sound. It will stand muster in an audit by OIG if they come through after the fact. And I believe this is a direct appropriation to the city of Las Vegas, not through the state, that any obligation for repayment would be made by the city, not the state.
Thank you. That sounds good. And the fact that you've got 97% of it expended, maybe we should let you guys run Dieter. I'm getting tired of the phone calls. Thank you.
Well, if I could pick up on that, one of the early strategies we deployed early on, and we really spent a lot of time very quickly early on strategizing about how to do it. And early on, it was not clear in the guidelines whether we had to have the money spent by the end of the budget fiscal year that we were in at the time. It wasn't till later that they clarified that guideline. So we chose to deploy a strategy that got the money out predominantly by the end of that fiscal year. And so that was a very deliberate approach that we took. Now, at the end of June, Treasury issued a report profiling the expenditure of the entire fund nationally. We're one of only a few cities nationally that had spent more than 90% of their money by the end of June. And there's an old axiom in federal funding. It's difficult to go into the federal government and ask for more money when you haven't spent the money they've already given you. And I think by the fact that we've spent virtually 100% of our dollars, we believe we're very well positioned to obtain new dollars going forward.
Well, like I say, good job and appreciate it.
Senator Brooks.
Thank you, Speaker Frierson. My question is regards to shared services from Clark County. You mentioned that the per capita allocation that was given to Clark County was based on their population minus what's roughly 650,000 people in the city of Las Vegas. And the city of Vegas and Clark County got the same amount per capita. There's clearly shared services associated with the pandemic that are provided by Clark County. Is there, like, when I think of, as an example, the Southern Nevada Health District or UMC that have county and state dollars associated with them on the response to COVID, were there any increase payments made to those organizations, or any shared shared expenses that the city of Las Vegas made into those? I'm a proud resident of the city of Las Vegas, but I'm right down the street from UMC, who's really done quite a bit, and of the Southern Nevada Health District, which has really done quite a bit of work in helping Southern Nevadans through this COVID response. Is there a contribution made from the city of Las Vegas to Clark County using the CARES funds? I don't see them in your line items to help with those services.
Not specifically. We have coordinated a number of things with the region on direct expenditures inside the city. And I'll give you an example. The ISOQ facility was a good example of that, where we did work cooperatively with the county. We provided the property, the Cashman complex. We worked out an arrangement where the county paid for the capital cost of building it, and we actually paid for the operations of the facility for the duration of when that facility was in place. The other thing that I should mention is that we didn't look at CRF dollars in isolation. We've really had three pots of funding that we've been deploying in pandemic response. One is the CRF dollars, another is FEMA, and the other is, because we're an entitlement city, we got some fairly sizable plus-ups in our entitlement programs, mostly with the U.S. Department of Housing and Urban Development. And I think Gary alluded to those in his part of the presentation. And so a lot of those, those pots of funding were used to stand up things for what I believe is our share or portion of services in the city, tandem with what was being done in the rest of the region. For example, testing. We have stood up pop-up testing on numerous locations throughout the city using our dollars. We have committed, for example, going forward today, while we ended the ISOQ at Cashman, we've committed Cashman to a regional permanent testing facility, and hopefully maybe even in the future, vaccine support center as part of a regional effort. So we haven't, we look at all those sources as being fungible and not really one particular thing going to one area of effort. We're fortunate that we have a full-time emergency management team or staff with experience in working with FEMA, and right off the bat, our team was able to apply for, and working again through the MAC, the county, through the regional effort, obtain FEMA funding for PPE and other supportive work. So I think we've been a good regional partner, but I'll say we're a big city. We're the 26th largest city in the U.S. We've got a lot of problems in our own city, and we've had to really be responsive to our own residents.
That answer your question, Senator Brooks?
Yes, sir. Thank you.
Thank you. Senator Kiefer?
Yeah, thank you, Mr. Speaker. I appreciate that. So from what we've heard and seen from the numbers you presented, really one of your top priorities was to avoid a RIF. And, it seems like you successfully did that. And I'm not questioning whether those expenditures were in line with the guidance as you've received them. But I'm curious as to why such a high priority was placed on that when, so it looked like almost 90% of the dollars you received were spent basically backfilling your existing budgeted payroll, when so many of the citizens and residents of Las Vegas were unemployed, unhealthy, struggling. We know the number of applications we're seeing for rental assistance and all that sort of stuff. So I'm just curious about the decision-making process that went into prioritizing, maintaining sort of the structure of city government versus deploying those resources to the people of the city.
So, I'll start off, and if Gary wants to add something, I'll let him add it. One of the challenges we faced is purely economic. I would say, and I made a presentation that last session at the outset of the session about, I think, what are the unique challenges, financial challenges the city of Las Vegas faces versus some of our peer cities in the region. We're essentially landlocked as a city. We don't have very many areas where we're enjoying new ad valorem tax growth that we can fuel our governmental expenditures from. And so we sat down very early on, right when the pandemic hit, and realized that in the month of January 21, we would go into default. We had enough fund balance to burn the deficit to get us through January. That's how significant our deficit was in relation to the total budget, in relation to available fund balances. So we believe we really didn't have much of a choice as a city in order to maintain our fiscal vitality, but to strategically figure out how to get the money into the city's budget to avoid a serious catastrophic failure financially as a city. And so that really was an underpinning of that decision. As we've been able to, we have been pushing every dollar we can out into the community. And I think we've been fortunate to get plus ups from HUD, to get FEMA dollars, to get other dollars that in every dollar we've been able to obtain has gone into business, housing assistance, or homeless assistance. And so it's been a balancing act. I will say, going forward, I believe that if there are new dollars that come available out of anything out of Congress, and we're always hopeful on that, although day by day you don't know what's going to happen. I think we're going to be in a better position should new dollars become available to push more of those dollars out, disproportionately more of those dollars into the community now that we've stabilized the city's financial condition.
Now, look, I appreciate the struggles the local governments have, particularly when it comes to financing through property tax. But I question that decision in terms of trying to keep the government whole rather than pushing those resources out to the people who need them. The purpose of government is to serve, not employ. And I think that those structural changes are not going away starting in January. So we've got work to do at the state level to try to fix some of those problems for you, probably. But I think that there were potentially some higher needs, and I'll leave it at that. Thank you.
Thank you. I have a question that I noted at the beginning of the presentation. You have indicated that you received your federal assistance directly, and I'm just curious about whether it was segregated or not for the purpose of transparency. I think the number was 118.9 million direct allocation from the U.S. Treasury into the city's general fund. But how do you, for the purpose of tracking expenditures and transparency in general, how did you segregate, or did you segregate the money outside of the city's general fund?
I think this is a great question for Gary.
Thank you for the question, Speaker Frierson. It was really.
And I'm sorry, gentlemen, even though we can see you, for our IT folks, I want to make sure the name every time we switch speakers. Gary Ameling?
I apologize. For the record, it's Gary Ameling, Chief Financial Officer for the City of Las Vegas. It actually was fairly curious how the U.S. Treasury did distribute the monies. Before we had even received any kind of calculation showing how much money we were going to receive, we received the wire transfer. So all we received initially was a wire transfer of $118.9 million. It wasn't until sometime later that they put out the actual population calculations. But as I mentioned in the presentation, it was a purely population-based distribution. And then the guidelines came out right about the same time the cash came in the door. So that was the initial look at how the categorization of expenditures, eligible expenditures, were allowable. So we quickly took a look at those. We decided from an accounting standpoint to segregate our expenditures through a series of accounting coding. So we set up various COVID-19 related account codes, personnel, various types of external expenditure codes, so that we were able to track all of them, because we are pretty familiar with grant accounting, having been a fairly large recipient. Scott mentioned earlier that we're a direct entitlement agency for CDBG monies. So we have a staff that's pretty familiar with government accounting and grant coding. So we set up a series of account codes that allows us to track those expenditures and to report on them in a way that we knew the U.S. government was going to want them to be reported in. So the table that I presented showed you the categorization that they've given us to report the expenditures in.
All right, questions of the committee? And I apologize while I was having technical difficulties. This was touched on, but I've been asking everybody if they at the close to just speak on your confidence that we won't have any funds left on the table, and that there's a mechanism in place in the event that there is, to make sure that we are able to best use those funds to serve our constituencies.
Well, I think we demonstrated that we've spent 97%, and that small remainder that we've got left, we've actually already let the contract on the dining facility at Catholic Charities, so that money's actually committed. So the only remainder is $700,000, which would be in housing assistance, and we don't expect that will last very long at all. So I think there's a high likelihood that 100% will be spent here very shortly.
And I think you mentioned housing. So if for whatever reason it was, you have that to spend the remaining dollars on, if there were remaining dollars.
Right.
All right. Any other questions of members?
Yes, Mr. Chair.
Oh, I'm sorry, Assemblyman Roberts.
Thank you, Mr. Chair. Back on Senator Kekeffer's question regarding the allocation, and out of your 118.9 million, almost 90% went to payroll. And could you break down what's the exact dollar amount for that? And could you break down where it went? I know you share allocations for funding Metro and some other things. And then I have a follow-up.
I don't know if can we pull that slide back up?
For the record, this is Gary Ameling again. We can certainly provide you the breakdown. We have, as I mentioned, 2 public safety departments of our own, the Department of Public Safety, which is both city marshals and our corrections function, as well as our fire and rescue department. And then we are a partner with Clark County in terms of funding the Las Vegas Metropolitan Police Department. Those 3 departments together totaled $104.9 million worth of the expenditures that were shown on our table. And then $4.3 million went to budgeted personnel that was diverted from substantially different uses. And that was a relatively small number compared to the public safety direct expenditures. But if you'd like, we can provide the split out of those expenditures by those 3 departments in public safety if you prefer.
If you could do that real quick, I'd appreciate it. It'd be fairly simple.
I'd be happy to get that for you. I don't have that information available right this moment.
So how much went to Metro?
I've got a spreadsheet here, but I'm not sure I can locate that exact amount right this moment.
No worries. Thank you for your indulgence, Mr. Chair. Just a quick follow-up. I know you had said that you didn't believe the state would be on the hook if there were any issues with how you expended the money, and it'd be your responsibility. If that happens, how are you gonna close the shortfall if you had to repay 118.9 back?
You know, it's our premise is, this is Scott Adams again. Our premise is there won't be a need to close a shortfall. That the regulations and the guidance provided by Treasury have been very specific, and they've been very specific about an ability to use the approach that we've taken on making these expenditures. So we've been spot on. You know, as Gary alluded to earlier, we have a great deal of experience in working with grant programs. We know grant program compliance. We know how regs work. And we believe that we are 100% consistent with the guidelines and regulations.
So zero chance that you're gonna have to repay it?
I believe that to be the case. They have been crystal clear as we've gone along. Now, when they first came out, I'm going to say, as Gary said, I mean, literally on the morning that we received the money, we looked in our bank account and we had $118.9 million there. Later that afternoon, they published 4 pages of guidelines that were fairly general. Since then, Treasury has been producing more guidelines that have been much more specific in providing guidance to the recipients of the funds. And pursuant to those more specific guidelines, we have been, every time they come out with a guideline, it continuously reinforces and supports our method of expenditure. So we believe we are consistent.
Thank you. I mean, a considerable part of my district is in the city. I got a few county islands, and if we had to come back with that repay, it would be a serious issue for us. So thank you for the answer. Hope you're right.
Assemblywoman Monroe Moreno.
Thank you, Mr. Chair, and thank you for the presentation. I have to express my concern. We've had a number of presentations from other local municipalities, and none of them, up to you, have spent the amount of money that you have on your regular budgetary operations of your city. So I have a question and share of concerns. Yes, I understand that you have previous experience with grants and regulations, but this is a new thing that's changed, I believe, a minimum of 9 times since our state and the cities were initially received their allocation of funding. So if 90% of what you received went to salaries and backfilling your regular government operations, then who picked up the shortfall to actually help the residents? Was that the state? Was it Clark County? We have the National Guard here. How much did you contribute to that for the citizens of Las Vegas?
This is Scott Adams again. Thank you for the question. I think the other thing, and I'll have to say, because we needed to have a balanced budget by roughly mid-May, we had about 30 days from the point where we received the dollars to figure out how that money was going to interface with our budget going forward for fiscal year 20. We really looked at the CARES Act itself, the philosophy of the CARES Act, and where the money in the CARES Act went into the community. And so we believe that the direct dollars that went, the $1,200 stimulus payments to citizens, the money that went into the PPP program, and many other facets of the CARES Act was a substantial amount of funding that impacted the community. In fact, we have, one of the things that we've been basing our projections on going forward is a shared economic projection by a couple of our prominent local economists. And one of the concerns they've expressed to us is that we are getting close to seeing the impact of the CARES Act work its way through not just the national economy, but the regional economy. That impact was so substantial from the CARES Act on the community that there was a big plus up in the economy due to the impact of the CARES Act. And we believe, and I appreciate your concern and comments, but we believe that the intent of the CARES Act and the money that went to cities, the larger cities, was to help shore those cities up financially the same way the CARES Act did to businesses and households through those other mechanisms.
Okay, follow up, Mr. Chair?
Oh,
Okay, two things. So, in shoring up your budget, because you were looking at, you said at the beginning of the conversation that at the beginning of the year, you were looking to break even or even have a little money left over, but you utilized the CARES Act money that you received to shore up your budget. It's kind of a contradictory statement, but you've done increases. Did you lay anyone off? What other cutbacks were made? And if the federal government does decide that those funds were used inappropriately, although you say that you believe you did use them appropriately, if they do make that decision, what cuts will be made? How many people will lose their jobs? What budget reductions are you going to make if that does happen?
So Scott Adams again, and Gary, please chime in here where necessary. As Gary mentioned, we were facing a nearly $200 million deficit straddling fiscal years 20 and 21. Even with the injection of the $100 million of CRF dollars into our budget, we still made an additional $80 million in cuts across the city. I think our policy decision we faced at the time was how deeply were we going to cut public safety? Our city council has made public safety its number one priority. It has done so continuously, I know, since I've been an employee of the city, which is 16 years. And we wanted to maintain that high policy priority on public safety. But as we looked at our financial problem, I think, as Gary said, we could have been facing, without the use of it the way we did, really deep cuts in public safety for the first time in the city's history. I mean, real cuts where we would have had to brown out fire stations, shut down units at the correctional facility, and lay off marshals, park marshals. We didn't want to do that. And so, as Gary mentioned, we created a funding strategy for the budget, which deployed use of CRF dollars, $80 million in cuts, but the cuts were felt predominantly in non-public safety functions so that we could soften the blow to public safety, which is why we used the dollars to offset our public safety costs during the pandemic. It was a policy decision. It was a policy decision that we made with our city council, with our eyes wide open, and it was one that was out of economic necessity, as I stated before. I truly believe that the city of Las Vegas is uniquely different than our peer jurisdictions. We are landlocked, and while Gary mentioned that going into the pandemic, seat tax was performing well, property tax has been stubbornly low. And we only have so many places we can generate property tax. So we were in a situation where we could have precariously been in a very, very difficult situation financially in a very short period of time. And led to the decision we made. It was a policy decision, really driven by maintaining essential functions, and our primary essential functions that our council's prioritized has been public safety. We didn't want folks to call 911 and have horrible response times.
Woman, I think you muted.
Thank you. It's just be my final follow-up. Thank you for further explaining the policy decision that you made. It was a policy decision that every city within the state and we as state leaders had to make when we went into 2 special sessions. So I would ask if you could get that information of the cuts that you refer to our committee so we could see them in writing. That would be, I think that would help in us understanding exactly what all went into those policy decisions, where that money went, not just in public safety, because when public safety is shared between the city and the county with Metro. So I believe that 911 call would have been answered. So if you could get that information to our committee, that would be most appreciative. And thank you, Mr. Chair.
Thank you. And I just want to be clear, and Assemblywoman, correct me if I'm wrong. I mean, by the end, we were talking about public safety, but I didn't hear your question as being specific to public safety or questioning whether or not public safety should be a priority so much as questioning the entire expenditure. So it's not a function of public safety. I mean, I guess I'm just saying the answer can't always be, if you didn't like 80% of how we did it, then the 911 call wouldn't have been answered. I think it was a broader question about priorities and decisions. Of course, we support public safety. I don't think that was a question. It felt like the answer was juxtaposing our concern with public safety. And I don't think that any of us were trying to put that comparison into the question.
Correct.
Mr. Chairman, I apologize if that was taken, if that came across that way. This certainly was not my intent. I was just really trying to explain a very quick series of policy decisions. We had to make these decisions very quickly. I want to put it in context. I led the city's budget cut process back in the Great Recession. We cut $100 million of our budget over 3 years. We had to cut $200 million in 30 days. Not an easy decision to make for a city. And we had to do it in concert with our city council from a policy perspective. And I certainly didn't intend to put in juxtaposition make any insinuation that you don't support public safety, not at all. I was just trying to explain how we arrived at the conclusion we did and how we made a strategy-based policy decision to expend funds.
Well, and Mr. Adams, I tried 1.25 billion on for size. We certainly understand, the enormity of the task ahead. And it sounds to me, correct me if I'm wrong, it sounds to me from what you said earlier that things did happen fast and we only had a finite amount of time to make sure that, these funds were put to use. So the city of Las Vegas made a decision to expend it quickly with the hope that that would put the city in a better position should there be additional funds available to say that they expended the funds that were made available to them at that time. It sounds to me like maybe other jurisdictions were more concerned about the how, not necessarily the what. And so they felt like maybe they were in a better chance to get additional funds because they had a plan in place. While all of it may not have been allocated immediately, that they had a plan in place that showed responsibility, that they'd be better situated to be competitive for additional funds. So I'm not villainizing either approach. Is that what you're saying was the city's approach versus what maybe other jurisdictions' process was?
Mr. Chairman, Scott Adams again. Yes, I think it was also born in the fact that I think our council and we believe that by maintaining, and that's why I made that statement at the front about what our priorities were, that if we could maintain the operations of our essential functions, we would be serving the community. As a local unit of government, everything we do serves the community, especially in public safety. And so it was really for that reason.
Okay, and again, I appreciate you. It's not just public safety. When I ask a question, that can't always be the response. Is the public safety component, because of course we support that. But I certainly understand, and I don't envy. Just like we had to make tough decisions, cities sense of urgency to make some decisions about how to best use the money, and hope that if there were additional funds, you'd be best situated to be able to utilize those. And quite frankly, I'll say this: I agree with you that everything that local government and state government, for that matter, does with respect to the face of services to the community serves the community. So I'm not judging which approach at all is most prudent. Doesn't look like we're going to get additional funds as of yet by the end of the year anyway. But our function here is to shine light on it, but also to make sure that we don't send anything back, and that we make the best use of what was allocated. And sounds like you're confident that you guys did what you thought was best for your city.
Mr. Chair.
Yes.
Assemblywoman Tolles, I just wanted to clarify, following up on Assemblywoman Monroe Moreno's request for more information. Did we get specifically what we would hope to expect in that report in terms of transparency and a timeline, or those breakdowns of cuts?
Was that a question of us?
Yes.
I think, Gary, I think we could provide that information fairly quickly. I know we have it already organized. The cuts, which is our decremental cut plan, is available, readily available. It's just Gary doesn't have it at his fingertips. We certainly have the breakdown of the coronavirus relief funds, such that I think we could have that to you very quickly. And my hope would be, you tell me, Gary.
Next week. We can definitely get it next week.
Yes, absolutely.
And I believe Ms. Jones had some input on that. And I think my follow-up question would be, is that something that we can post on this subcommittee's website for the benefit of the public?
Thank you, Assemblywoman Tolles and Chair Frierson. Our normal process is that at the conclusion of any hearing, just like any other IFC hearing that we would have, or subcommittee hearing, staff compiles a list of questions that are sent to the various testifying entities, including these recent requests regarding the breakdown of some of the reductions made by the city of Las Vegas, and provides them an opportunity to respond. And then we send that information on to the members of the subcommittee. Thank you.
And do we post that? I apologize if I missed that. And do we post that for the public to be able to see that as well?
Typically, the responses are sent to the members, Assemblywoman Tolles, but if the speaker would like the answers, or the chairman in this case would like those answers posted, we could certainly do that. Thank you.
Any other questions? I'll take a look at it, and as we do with minutes and other documents that are provided, make a decision about what we're going to post. I'll take a look at that. Other questions of the committee? Anyone? All right. I see none. Thank you, Mr. Adams and Mr. Ainley, for your presentation and for following up. I appreciate you being able to make yourself available to help enlighten the committee.
Thank you very much.
Thank you.
So we will move on now to City of Reno. And I think we'll kick off the city chief of staff, Dylan Shaler.
Thank you so much, Mr. Speaker, members of the committee. For the record, I am Dylan Shaver, the Chief of Staff to the City Manager to the City of Reno. It is my pleasure to present to you today here on behalf of the biggest little city in the world, the City of Reno, home to the 1868 Football Club, which recently bested the Las Vegas City Lights to hold the Silver State Cup in soccer. We look forward to their playoffs this afternoon. I would be nevertheless remiss not to congratulate Scott Adams, who's always a tough act to follow, on a illustrious career in city government. I believe he's retiring just the end of next month. And of course, to Senator Kiekefer in advance, thank you so much for your commitment to work on property taxes for us. That was kind. But we're here to talk about the Coronavirus Relief Fund, and I will share with you where the city has been on this heretofore. As you can see, and as the governor announced at the end of June, the city of Reno would receive a $46 million share. That came in two halves. We do have both halves in our account right now. These are funds that the city sought, and we solicited. As soon as we knew the money was coming into the state, we reached out to the governor, reached out to many of you on this committee, and thank you to everybody who allowed this to happen, because it has allowed our city council and our team here to put together some great programs here in the city of Reno. Speaker Frierson, you do touch on a critical point here, and it's an analogy I've had to stop using here at the organization just because of the youth of my staff, but I believe most of you will understand that we have a Brewster's Millions situation in front of us right now. With $46 million in the bank, our first allocation came through on August 11th of this year, leaving us just about 117 days to spend it all. And so we have been working diligently to develop a plan. And our plan relied on input from key stakeholders across our community. We saw proposals come in from nonprofit groups, as well as input from our elected leaders, all to develop a program that we believe would deliver the best benefit to our citizens as possible. We did that as transparent as possible and have tried to involve the public in every step. And to that point, we have 4 more planned public hearings around our Coronavirus Relief Fund allocation that will both allow the council opportunity to remain nimble and adjust our targets for this spending between now and the end of the year, but also make sure that the public has an opportunity to see what we are doing, especially if what we are doing is a program that will help them get through this terrible, terrible time. When you have a pot of money like this from the federal government, you need a spending plan, but you also need comprehensive internal controls. We've developed a multi-check system here at the city so that we do not put the state in the position of having to come asking for this money back. The last thing I think anybody would need would be to be in that situation. So we have an internal team that is our finance department, our legal team, folks in the city manager's office that review this. Everybody who puts forth a proposal for how these funds has to certify a number of things, and really to make a compelling presentation for you, I included a picture of our certification form so that you would know we mean business around here. The needs in our community, like everywhere, like you saw during your special session, and like you've heard from every government before you today, are infinite. And, you know, we worked hard to try and identify the city of Henderson, I believe, used the word buckets. I like that word, buckets of need throughout the community that we would then sort of allocate resources to and disperse from based on necessity. A lot of the folks you've seen today have talked about their business relief program. Here at the city, we have set up our own to the tune of just north of $5 million. This includes support for local artists and musicians that we have been working on with a local nonprofit, economic assistance program aimed at helping those businesses that were shut down the longest and hit the hardest by the virus. And then a special side pot specifically for a small business relief program for women and minority-owned businesses in our community. I will say that we've allocated just north of $5 million, but we have seen just about $9.5 million worth of applications and requests from that fund from the business community alone. It is no secret that this has taken an incredible economic toll across our state, and Reno is, of course, no different. We've been trying to do some innovative things on housing support without stepping on the state's toes, because, of course, there is a state program. So the easiest thing for us to do was when we set aside $4.5 million in funding from our allocation to support housing and keep people in their homes. The first thing we did was we turned around and cut a check to our housing authority, just like the state did, to supplement that program. We wanted to make sure that the resources that were going into that were not duplicated within our organization. And, you know, I don't have a housing staff, but we wanted to make sure that money got out there and got out there quickly. We did put out an RFP for a landlord-tenant mediation program to sort of sit people down at the beginning of the process. And we worked with our weekly motels on a relief program as well. Most housing assistance requires a lease, and these weekly properties do not. And regardless of what we may think of it, many of our most vulnerable populations do live in these. And we wanted to make sure that there was an opportunity for us to sort of keep them housed, sort of a housing first approach to this. Finally, we have been paying a close, keeping a close eye on Justice Hardesty's eviction prevention program. We have sort of an agreement with the Justice Court here where they would allow us basically to station one of our city attorneys full time just to intervene should there be an eviction case that pop up. But of course, with evictions delayed and then delayed again, you know, we will likely have to find a new tranche for those funds to be allocated. We set aside just under $8 million for support to what is a sadly booming unsheltered population in this community. It is no secret that you can drive through downtown Reno and see just how challenging the situation has become for us, thanks in part to the ravages of the virus. The city operates its own homeless shelter, the Community Assistance Center here, in partnership with some of our regional partners like the county and the city of Sparks and some nonprofits. For lack of a better term, the strategy when you open up a homeless shelter is to fit as many people in as possible, serve as many as you can. You don't want to turn people away. Well, unfortunately, the coronavirus has the exact opposite idea for us. So we had to think very quickly to address that without putting people out on the street. For us at the city of Reno, that meant to put them into an event center that the city happens to own in one of our redevelopment areas. And we use that for housing the unsheltered for a number of months while we sought more permanent and more acceptable solutions. We have set up a series of temporary tents, like the one pictured here, at our facility, just to allow for more sheltered area. And we continue to look at other options, especially as the winter approaches. We definitely don't want to have people turned out onto the streets in what is really the most challenging time to be out there in this community, but we also don't want to put them at risk of exposure to the virus as well. So we've set aside significant resources in partnership, again, with our friends at Washoe County and the city of Sparks to find a solution to this that both protects our community from the virus and gives them a roof over their head in what will be a terrible time. Food insecurity very quickly became a challenge in the community. We set aside just north of $1 million to address that. And These funds will go to support our food bank, will support the campus food pantry at the university and their distribution, and it will support our school districts. And unfortunate side effect of children not going to school, and this body knows far better than we do at the city, that a number of students get their food at school, breakfast and lunch. And when we set aside this money for school, that the district and the food bank reminded us, well, they're not coming here, but they still need to eat. And so we've been happy to partner with WCSD in a number of ways, but a big one is to help support this food distribution program. We allocated $1.3 million to support socially distanced programming in our parks. This is support to nonprofit and business entities who can conduct services that would basically replace the services that we normally offer through our parks programs that now we can't. Now is not the time for the city of Reno to be offering senior recreation programs. And thanks to the downturn, we had to lay off a number of our staff who do that anyhow. But what we did find was that we had the opportunity here to do some good out of the community, and we took in dozens of proposals from community groups who were interested in stepping up to this particular challenge and conducting their business in a socially distanced way that helped support park users and vulnerable Reno residents. Speaking of our partnerships with the school district, we are particularly proud of, and I believe I have a contract in hand on this now, to provide 5,400 laptops to at-risk students across the city. This is an agreement that's about $2.5 million, and it has been months in the making. The district came to us shortly after the governor announced his awards to remind us that the families that we serve are the same as the families in their schools, and can there be help? And we said, of course not. And then we moved on. No, we particularly our city council, but even as a staff, we wanted to find a way to support this kind of activity. Knowing that, this is our community. These are not just a statistic somewhere within the school district. There are going to be a lot of challenges with distance learning. We don't really have an end in sight as to when this is going to come up. We wanted to make sure we did what we could to support both the districts as well as facilities that are facilitating distance learning elsewhere, whether that would be a daycare or a Boys and Girls Club or something like that. You don't have to go too deep into Google to see the terrible ravages on mental health that the COVID-19 crisis is having. We wanted to find a way to enhance, for example, our mobile outreach safety team. I believe you had discussions about this at the 31st special session. And the importance of sending social workers out into the community where social workers would need to be. This is a partnership, that allows us to send police to situations where really it may not be appropriate for an officer to go. From this area too, we're entertaining proposals to expand suicide prevention education to students in middle and high school, as well as working with our partners in the region to establish some sort of diversionary program to ensure mental health cases are not going to the emergency room right now, where it is taking up valuable space that could be used for other cases, as well as exposing those potential patients to the virus unnecessarily. Of course, we do have a city to operate, just like everybody else. And I cannot speak for other organizations, but ours was not suited to send folks home to work from home indefinitely, nor was building optimized to slow the spread of the virus. So we wanted to make sure that we did set aside a pocket of money to allow temperature screening for people coming in and out of the building, to put in touchless faucets. We've put in plexiglass shields at all of our customer interface counters, as well as, sort of provided the equipment to our personnel required to do meetings just like this one, because most of our staff wouldn't have it. This also allows us to take a look at what our various departments are doing in response to not just the virus, but to help get us off our feet. And so what we've pictured here is the mobile vaccination unit. If I knew it just looked like an RV, I would have found a picture of something else. But the mobile vaccination unit is something we have in place now that will allow us, as soon as the vaccine is available, to go and deliver that in as many places as possible and make sure that that can get distributed equitably throughout our community. There were there's a handful of direct city expenses that I think all of the jurisdictions have spoken about here, but this is the pot of money from which we would pay our, we offer a certain type of family leave for people who are affected by COVID. This is where our city's PPE supplies are paid from. This is where we're paying all of the overtime costs that are required for our first responders and others in the organization to address the ravages the virus has had throughout our community. This is also the fund under the guidance from the federal government, where we are paying the unemployment claims for the personnel that we laid off at the end of the COVID recession. Finally, and Manager Brown touched upon this a little bit in his presentation, we are part of the Regional Emergency Operations Center between, again, Washoe County and the city of Sparks. And this is basically the amount to cover our share of that in case FEMA does not pay out. We did some pretty serious and deep thinking on this, and it does not appear that any time in United States history has FEMA had to pay out Stafford grants to literally every state and city and county in the country all at once, to the tune of what is likely to be trillions of dollars. So we found it prudent then to sit down and make sure that we had set aside enough money to cover our commitments to that regional operation through the end of the year. So not to be faced with having to pay that out of our city's general fund. Should those reimbursements come in from FEMA in a timely fashion somehow, we would of course reallocate these funds to a different bucket. And with that, Mr. Speaker, members of the committee, I will say that it has been an honor to serve our community through this really difficult time. No plan is perfect. There is no guidebook for you or for us to respond to any of this. And so thank you for stepping up and doing your part. We can only hope that you believe we are doing ours. And I am here, of course, for your feedback and questions.
Thank you, Mr. Shaver. Questions from the committee? I'll go to my default at the end to ask everybody, but members, do you have any questions? Different chats. Anyone? Mr. Shaver, how, again, this is the question I've asked everybody, but how confident are you that by year's end there won't be a balance left over that will have to be returned?
Mr. Speaker, as I mentioned, Dylan Shaver for the city of Reno, for the record. We have had, for every category I have shown you today, we have had significant overages in terms of the requests coming into it. For the business programs alone, it's literally millions of dollars that we just haven't, in requests that we have not been able to fulfill. So we believe that there are many venues that would allow us to spend those funds. My larger concern would be about the mechanics of actually putting the checks through the standard municipal check writing process between now and then. And I will commit to you, Mr. Speaker, that I will come in on the weekends and until 2 a.m. to make sure those checks get cut and out the door before the 30th of December.
Thank you. That's about as clear and direct as we've gotten so far, but I appreciate it. Other questions? Committee? Anyone? I see none. All right. Well, thank you, Mr. Shaver. We will let you get about your day. Happy Friday, and we appreciate you making yourself available to present to us and to make this shine some sunlight on what's going on through the rest of the year.
Thank you.
All right. I lost my list. Here we go. I think we are now prepared to move on to the Nevada League of Cities and Municipalities. Is Mr. Harper available, or could we get him in the queue?
Yes, I am available, Mr. Speaker. Thank you.
Thank you very much for being here.
Thank you. It's a real privilege to be able to address this body. Thank you, Mr. Speaker, and to the committee. Is it okay for me to go ahead and share my screen?
Please do. Our BPS may need to assist, but we'll stand on the ready just in case. Here we go.
All right, again, thank you. It's an honor to be able to present to this committee, an honor to be invited. I want to say at the outset that for all the member municipalities that received an allocation, it is appreciated. It is not a secret that not all cities and all states were able to receive an allocation. So we absolutely do not take it for granted. When the CARES Act was announced, one of the first things that the league wanted to do was to make sure that we were well educated on the provisions of the CARES Act, as well as making sure that we were acting in a harmonized, consistent way with the Nevada Association of Counties. This is to make sure that we didn't duplicate efforts, to make sure that we had a clear and consistent understanding. So we spent time up front. Ms. Stapleton alluded to this in her presentation. We spent time up front making sure that we were clear on what the rules were, what the expectation of the federal government was. Then the league had conversations with each municipality, each of our member municipalities, and with North Las Vegas to ensure that they had a clear understanding of how this money can be spent. And then as the allocations were announced, we were appreciative of NACO's graciousness in allowing us to really work with the content that they had developed for training on not only the audit, but the use and the kind of programming that is allowable and keeps jurisdictions in compliance. So we took advantage of that as well. So the Nevada League of Cities represents 24 member municipalities. Of those 24, we have 4 in Clark County, and that would be Las Vegas, Mesquite, Henderson, and Boulder City. And so, of course, the committee has heard from Boulder City, Mesquite, and Henderson, along with Clark County in their presentation. Las Vegas presented directly. Outside of Clark County, you heard from Reno, which is one of our members. You just heard from Mr. Shaver directly. And Carson City is another member. Ms. Stapleton did a comprehensive explanation of what Carson City, how they've approached their coronavirus relief funds and how they're giving benefits to their residents. So as a result, really this presentation is focused on the 12 remaining member cities. Of the 14 member cities that were allocated from the state, that was nearly $90 million. Of that $90 million, Reno received approximately $47 million. Carson City received approximately $10 million, which is about 63% of that total allocation. And so what we're talking about is the remaining 37% over the remaining 12 member municipalities. Generally speaking, most municipalities got their initial distribution, which was 50% of their allocation from the state between the third week of July and the second week of August. There's an exception or two, but that's generally the case. Also, most municipalities have received their second 50% to continue to provide benefits to the residents. For the most part, member municipalities have elected to take that second 50% as a lump sum upfront distribution. A few have chosen to do it through a reimbursement method in order to ensure that they are spending as they need. I have had conversations with each of these 12 municipalities, along with City of Reno, and communications with Carson City, and they are all intending and on track to spend the entire allocation by the December 30th deadline. So, as you would imagine, each city is a little different, and their priorities vary based upon the needs of their residents. But the basic spend categories have been public safety and the retrofits of their buildings, city halls, other public spaces for the safety of their employees, as well as for the public that come to do business in those buildings. The retrofits have essentially centered around social distancing protocols, as well as installing or improving distance technologies. We have been encouraging collaboration between each of our member cities and the counties in which they reside in order to bring the highest and best benefit to residents. Fallon and Churchill County have combined in the business grant program that Ms. Stapleton referred to in her presentation. Mr. Schaefer and Manager Brown talked about the collaboration between Sparks, Reno, and Washoe County, particularly around the issue of homelessness there. West Wendover and Elko County have come together for community-wide testing. And Winnemucca and Humboldt County, they have come together around small business reimbursements. Another area that significant spend all over these 12 member municipalities have been in the quarantines, as well as helping children that are in hybrid education models, whether distance and sometimes distance in the morning, in classroom participation in the afternoon, or the reverse, or 1 week on or 1 week off. They have put money into facilitating the logistics around that. And certainly a significant amount of money has been put into personal protective equipment and specialized cleaning. And while I have the attention of the committee, I do want to bring up one of the issues that the league has been trying to navigate. I mean, as mentioned, we have membership from across the state, and in Clark County, our members, of Henderson, Boulder City, and Mesquite were in a difficult situation based upon the allocation that they received. The allocation that the residents of other cities and counties received was at about $184.45 per person. For Henderson, Boulder City, and Mesquite, their allocation was half that. And that half came through Clark's counties stepping up and providing that allocation to them. And we appreciate Clark County for for that gesture. And I say it this way because my understanding is that Clark County had expenses resulting from the pandemic that would have completely exhausted their allocation that they got from the federal government. Notwithstanding, they recognized there was a need by these member municipalities. And so we appreciate that they rearranged their finances in such a way to provide an allocation. On this issue, NACO, Nevada Association of Counties, and the League met with the governor's office on June 22nd in order to discuss this as an issue. And it was indicated in that meeting that this body, Mr. Speaker, this committee would have a say or influence in how the state might look to address this inequity. And so our hope is that this body believes that each Nevadan should have the same equitable benefit of this CARES Act funding and make mention of that position to the governor if this board sees fit. And so with that, I'm happy to take any questions you may have.
Thank you. Committee members, do we have any questions?
Mr. Chair, Senator Goycochea.
Senator Goycochea.
Thank you, and I'll be very brief. It's come to my attention over the last week or so, there's some issues with the Wendover school. So I was wondering if in fact Wendover and Elko County had in fact reached out to the school district as well, to your knowledge.
Thank you for your question, Senator. I had a conversation with West Wendover. Give me a moment for my notes, please. So in the conversation that I had with West Wendover, they did not specifically say what they were doing with respect to any issues with their schools. They talked about their other priorities and where they've spent senior center and the food bank Meals on Wheels program, upgrades to deal with the spike in demand due to the economic shutdown, PPE and supplies, working with the medical clinic that's there for personnel, supplies, and equipment. But in my notes, and I apologize that they may have mentioned that to me and I just failed to record it, but in my notes, I don't have any information on that. I apologize, Senator.
I appreciate that, and it's something that just recently surfaced, so it might not have been on their radar even. Thank you so much.
Thank you. Other questions of the committee? I don't think I've seen any. No, I don't see any questions. All right. Well, either it's late in the afternoon or you were thorough and concise.
Thank you, Mr. Speaker.
Thank you for being here. And again, thank you for making yourself available. And to the extent that this committee is in a position to make a recommendation moving forward with additional funds, I certainly appreciate that advocacy, and we will most certainly keep in mind. And I recognize, and this goes for every local government entity that's been before us, that we're all fighting the same fight, and that's serving folks best we believe that we can. So to the extent that we can continue to coordinate and shine light on it, I think we're doing a service in and of itself, and best we can be responsible with the limited money that we are getting.
I truly appreciate that, Mr. Speaker. Thank you to the committee.
All right, thank you. We will now move on to, I believe, the review item number 6, review the residential rental assistance program with B&I Housing Division. I don't know for sure who is. Let me see if I can find my list. Great. I don't want to mispronounce last name, Mr. Acroft.
Spot on, Mr. Speaker, so thank you. Before I bring in my presentation, I believe Treasurer Conine wanted to make some opening statements.
Oh, I'm sorry. He did mention that, and I had him down. But Mr. Treasurer, you want to make some remarks under item 6 in B&I?
Yes, Mr. Speaker, if that's all right. Can you all see me?
Yes, thank you, Mr. Treasurer. Please proceed.
Absolutely. I appreciate the flexibility. Hello, Mr. Speaker. Hello, members of the IFC subcommittee. It's an honor to be back in front of you talking about some of the work that our office has done in partnership with other offices to try and speed up this economic recovery as much as possible. As we all know, housing instability leads directly to economic instability. Never was this more clear during the last recession, where we saw people lose their homes, be foreclosed on, have to move out of town. But more importantly, when you are housing unstable, it is much less likely that you will spend money and much less likely that you will generate tax dollars, as much of our income is driven by, at the state level, is driven by discretionary spend. So our office became involved early on when the governor's office originally gave the green light for housing programs. Just to speak a little bit about the size of the problem, the Aspen Institute in August put the number somewhere around 140,000 households in Nevada were at risk of eviction during Q3. That number goes up to about 180,000 at the end of Q4. And Justice Hardesty hit the nail on the head this morning when he said we are reaching a very strange place where the need for eviction help will be the greatest right around the time when the CARES dollars are no longer able to be spent for the program. So we'll continue to advocate on the federal level to try and get that sorted. Now, the numbers will continue to expand as to the number of Nevadans who need help from an eviction perspective as the $600 additional federal pandemic unemployment compensation continues to roll off. I think you heard about that a little bit earlier on, that the benefit of that from an economic perspective is significant across the state. And so we've seen those numbers start to tick up as families go longer without that additional help. Just wanted to give a brief overview of the timeline, how we got to here. On June 22nd, our office got the green light from the governor's office to implement a commercial and a residential rental assistance program. On July 14th, we appeared in front of IFC to get the green light for the program, that $30 million chunk of money that came out of the CARES Act funding into this. We started taking applications on July 20th, 6 days later, and on August 17th, Clark County paused applications, as they said earlier on, in order to allow for the system to get caught up, but also to understand how much of that backlog was duplicative, right? In that 41,000 initial applications, how many of those were people applying to multiple agencies? On September 25th, the system shifted in the Rural Housing Authority and the Reno Housing Authority. We'll talk about that a little bit, but moved from confirmation to attestation. And then next week, as Clark said, they'll be opening up again using their new process with additional resources to help get money out the door, and they'll be switching to an attestation model in general. Now, to speak to attestation just really briefly, one of the biggest hurdles we've had in getting money out the door to date with the programs has been making sure that people can complete all the information and get it all the way through. To wit, in Reno, 26% of the files that were started ended up getting closed amongst eligible individuals. And that's just because the amount of information asked for the program takes a lot of time to submit, takes a lot of time to review. And then, of course, we need to get the landlords involved in the program. The attestation method, which we're seeing, oh, I'm sorry. No, that's just me. Okay. The attestation program, as we're seeing around the country, is a way to speed that up. And that requires the recipient of the funds to say, yes, I need these funds. I fall within all of these categories, not changing the rules around the program, but changing the amount of information we require up front. We've seen very quickly a pickup in dollars out the door in the rural communities and in Reno, and we're hopeful that that passes through to Clark. To get back to your kind of overarching point, Mr. Speaker, yes, we believe that we're going to get the $73.5 million currently eligible or in the program out the door by the end of the year. And we believe the total need for the program is something like $1.2 billion. So obviously need far outpaces supply. And we're going to do everything we can to make sure that money gets out the door so that we can go get more from the federal government. Brief overview of the dollars to date. In the Clark program, $30 million originally came in from Clark, $20 million came in from the state, and there's an additional $10 million to support the eviction mediation program, a majority of which is likely to end up in Clark for a total of $60 million. In Washoe and in Reno, we put $5 million in the state program in that, and we also got an additional $2 million from Sparks and $1.5 million from the city of Reno, which Mr. Shaver just alluded to. And in the rural communities, we have dedicated $5 million for the remainder of the state. Just like to say that it's been absolutely wonderful working with my favorite non-treasury department in the state of Nevada, which is the Nevada Housing Authority. They are public servants, gentlemen, scholars, and ladies. And it's my pleasure to turn it over to Steve for a little bit more information.
Thank you. Thank you, Treasurer. Just to add a little bit more color to that.
And just again for the record, this is Stephen Acroft.
Yes, sorry, Steve Acroft, Administrator of the Nevada Housing Division, for the record. It's getting a little late in the afternoon. First of all, to go back, it's sort of mutual. I want to provide my sincerest thanks to the Treasurer's Office, Clark County Social Services, the Reno Housing Authority, and the Nevada Rural Housing Authority for their collaborative efforts in providing rental assistance to Nevadans. A lot of this is well-tilled ground today, so I'm not going to spend a lot of time on it, but just for the committee's edification, as we were developing the program, Clark County was developing their own program. And through those discussions, we used their program as a blueprint for the state, adopting their eligibility criteria for the consistency across the state. As has been indicated, they started off with $30 million of their own funding, and we are providing $20 million in reserves. So when that is depleted, they will be able to access those funds. As of right now, that will be done on a drawdown basis, taking the division about 4 working days for them to receive funds once they ask for it. In Washoe County, as indicated, $5 million to the Reno Housing Authority. And since going to the attestation process, as was indicated by the treasurer, they have reached back out to about 500 applicants who had incomplete applications, and they expect to convert a number of those into eligible recipients. The RHA has indicated that they may not get through all of their funding by December 30th because of the additional funding that the city and county, or I'm sorry, the city of Reno and Sparks has given to them. But I wanted the committee to know that there is a clawback provision in their agreements so that we have the ability to reallocate those funds if necessary. If they can go to Clark County, they can go potentially to the Rural Housing Authority, who are providing the rental assistance out in the rurals. And with that rural assistance, they've done about 821,000 in disbursements. They anticipate 3.8 million of state funding expended by 12/30. But I will say, going back to what was indicated earlier, the eviction process, the expiration of the moratoria is sort of a game changer. So we do anticipate those demands being upticked quite a bit. And then wanted to address, I don't think Assemblywoman Benitez Thompson is still in the committee meeting currently, but she asked a question regarding duplication of local funding in the rural areas. That was echoed by Senator Goycochea. The payments go to the landlords direct. So when we are going to fund, or when NRHA would fund the landlord, they would see the rent rolls and the lease agreement provided by that landlord to determine that, in fact, funding has already been paid. And then the last thing I want to make everybody aware of is we have a weekly informational call with the governor's office, Chief Justice Hardesty, the treasurer, legal aid, Clark County, Dieter, to provide updates on those funds that have been expended, so everybody is well aware of what the status of the program is. And with that, I'll take any questions.
Sorry, can you hear me?
I can hear you, yes.
Oh, okay, I'm there, thank you. All right. Yeah. My lips. Sorry, I have a little, there we go, Mr. Presenters. Mr. Treasurer, I had a few other folks that I thought were gonna also be presenting. Were they just there for support just in case there were questions, or?
On the commercial rental assistance side, sir, or on the residential one? I think this is it for the residential side.
Okay. Well, Mr. Treasurer, you answered my question at the very beginning, so, about the likelihood of there being anything left over and what will be done with it. Are there questions of the committee? All right, seeing none. Thank you very much, and thank you, Mr. Acroft, for your information as well. Since we have Mr. Treasurer here, I guess we can move on to item 7.
Thank you, Mr. Speaker. Next, just wanted to take a few moments. Thank you all for the time to talk about the Commercial Rental Assistance Grant Program, or CRAG program, a program in which Nevada businesses were able to access up to $10,000 in rental assistance in order to keep their businesses going. Let's start off with, I think, the point here, right, which is that this money was able to support more than 800 Nevada businesses, keep them open, keep them hiring, and keep people employed. And we think that's really important. To talk through the timeline real briefly, I know we've talked about commercial rental assistance over and over. I'm sure you're all relatively tired of me, but just to go through the timeline, on 6/22, the governor's office gave the green light to our office and GoEd to put that program together. We brought it in front of the Interim Finance Committee on July 29th. On August 10th, the program went live. We started taking applications on August 24th. That was expected to go for 1 week. We ended up extending it for 2 weeks. We also, at that point, standardized the amount at $10,000, regardless of amount of loss, as long as your rent that was owed exceeded that. We also removed the PPP limits, the Paycheck Protection Program, just to make sure that people weren't being excluded from the program if we could avoid it. If you'll remember, during the Interim Finance Committee, there were some questions from members about eligibility. We took those to heart and worked with GoEd to remove most of the eligibility concerns that were had by members of this group. The only folks who ended up still being ineligible for the CRAG program were both people who had home-based businesses, because of course they didn't have leases that were work-related, and individuals and businesses that were illegal at the federal level, so primarily cannabis. On 9/23, all applications were due. We've been flexible with folks if they had a problem with the technology or had a problem, in a lot of cases, getting their landlords to sign on. We were flexible to allow them to make sure they could get out. We expect, assuming things go well at the Board of Examiners on 10/13, that we'll be able to get funds out in about 2 weeks from today, which we're excited about. We talked a little bit about the results of the program at the last committee hearing, last IFC. Happy to go through that a little bit more, but wanted to talk just briefly about the outreach. GoEd sent a communication to the 800 businesses they speak to on a regular basis. Our unclaimed property team reached out to 13,000 businesses who file unclaimed property here in the state of Nevada. The Gaming Control Board reached out to all small taverns, knowing that a lot of them had been kept out of PPP during the beginning of the process. And we did a fair amount of outreach on our end. Over the past 90 days, our office, a team of 2 people, handled 6,000 emails going back and forth between potential recipients and us. It's about 2,000 emails a month or 65 emails a day if we work 7 days a week, and we do. We conducted more than 25 outreach events and a couple of fun facts about the program. Zip code 89102 saw the highest number of applications, and we saw folks from art organizations to sandwich shops, CPA firms, jewelry stores, dry cleaners, churches, doggy daycares, dance studios, technology companies, etc. apply. We heard from small business advisors throughout the state that worked with businesses who had applicants who were single parents, who did not speak English as their primary language, and who are actually traveling to libraries to figure out the information. So that's a good opportunity for us to talk a little bit about rural broadband and how we're going to fix that problem. We heard from applicants who had been in the state for more than 30 years and did not qualify for the local programs, and so they were happy to have one that they did qualify for. We heard from corporate landlords who are working directly with their tenants on how to apply, making sure the paperwork's done. And again, for anyone still listening, we certainly encourage landlords and tenants to talk to each other. That is the most important piece of this process. And we've heard from hundreds of applicants on just how much this program will mean to their business and how much of an impact the pandemic has had on their livelihood. I want to thank my staff, GoEd, Business and Industry, the Nevada Development, or the National Development Corporation, excuse me, our vendor, and all those accountants, lawyers, and small business advisors and partners who did exactly what Director Brown from GoEd and I did, which was sit down with small businesses and help walk them through the process. I know a number of you did that as well, and we're deeply appreciative for all of those 800 businesses that we were able to keep in business. Happy to take any questions or go through any metrics if you'd like. Thanks again for having me.
Members, do you have any questions?
Mr. Chair.
Yes, Assemblywoman Holmes.
Yes, thank you, Mr. Chair, and thank you, Treasurer, for both those presentations and for also telling some of the stories behind it. I'm just wondering if there's information on your website to be able to look at what the report was, just where the types of businesses that received that funding and zip codes and so forth. Just curious to see how that was distributed out, and I appreciate again all your work on this.
Yep, and we're going to share that publicly. Treasurer Conan, for the record, we're going to share that publicly with everybody as soon as the final awards go out, just so we make sure we've got the right picture. Every once in a while, somebody falls in or falls out, so I want to make sure that we give a full picture. But we're happy to share that information. We've got all of it.
And do you also, Mr. Chair, just real quick follow-up, do you also have that aggregated out by women-owned businesses, minority-owned businesses, and so forth, just some more demographical information as well?
So because the program prioritized, Treasurer Conan, for the record, because the program prioritized traditional DBEs in Nevada, so women-owned, minority-owned, and veteran-owned businesses, and we added disabled-owned businesses and nonprofits to the prioritization list, we did ask those businesses for that information on the way, and so we should be able to, at least in the aggregate, highlight some percentages for you.
Thank you.
All right, any other questions of any members?
Mr. Chair.
Senator Parks.
Thank you, Mr. Chair. Today we've heard references to Nevada's Rural Housing Authority, to the Washoe Housing Authority, and Reno's Housing Authority. However, I haven't heard any reference to the Southern Nevada Regional Housing Authority. And my question is for Treasurer Conine is the Southern Nevada Regional Housing Authority a participant in these programs? Thank you.
Treasurer Conine, for the record, just to clarify, there is a Rural Housing Authority, there is a Reno Housing Authority that covers all of Washoe. They're the thing. I use them interchangeably and probably shouldn't. In Southern Nevada, Clark County took the lead on this process, and they got there first and designated that they were going to work with 14 different community partners, which did not include, the Southern Nevada Housing Authority. So we've been working through Clark County's program, which is not using the Southern Nevada Housing Authority.
Thank you, Treasurer Conine. Thank you, Mr. Chair.
All right, thank you, Senator. Other questions? Anyone?
Mr. Chair,
Senator Brooks.
I just wanted to thank the treasurer for providing me the resources that I needed to share with businesses here in my district. And 89102 happens to be right here in the heart of Senate District 3. So I'm glad some of that information stuck.
We appreciate your advocacy.
And likewise, the treasurer has been available with respect to CARES questions throughout the last several months, and it is definitely appreciated. Any other questions of the committee? Seeing none. One more. Let's make sure. Okay. Seeing none. Again, thank you for batting twice, Mr. Treasurer, for the last two items. And we look forward to being in touch as we kind of work through this last couple of months and make sure that we are doing right by the federal assistance we've gotten.
It's my honor, sir. Thanks for having me.
Thank you again. With that, I believe we have completed our substantive agenda and can move back to public comment. And if BPS, if you can queue up any folks that are in the queue.
Chair, this is broadcast. We typically take a 2-minute pause to allow the public who's watching on the broadcast to connect. Would you like to do that now?
Yes, yes. If we could just wait a couple of minutes and see if some folks call in.
Thank you very much. Thank you, Chair. And the public comment line is open and working, but there are no callers at this time.
All right. Well, seeing that we have completed our business and there are no further members of the public wishing to make a comment, we did well and finished within the window that I think we predicted. So I thank you all for your attention and for your patience. We will circle back. And for members, if you have suggestions on subject matters for future meetings, please let me know. if we even are going to be able to, and we will certainly consider that. But with all of that being said, this meeting is now adjourned. Thank you all so much.
Thank you.